Yeah, thanks.
All right. Well, good morning, everyone. Hopefully your morning is going well and we're off to a good start. We had coffee, tea, or juice. Um, I'm I'm personally a matcha green tea consumer, and I probably drank too much this morning. So if I go too fast, I'll let Eric slow me down a little bit. My name's Paul Terraces. I work for San Bernardino County Department of Behavioral Health, Substance Use Disorder and Recovery Services. Been with the department for a few years now. I've had multiple roles within the department. I used to work as a contract alcohol and drug counselor back in 2003. And that's where I learned to navigate what was called the Simon system. And so as I go about my training today, just know that I've made numerous amount of mistakes and had, a lot of confusion on how Simon works. But through the years, I got to know the system. I got to know the codes for CalOMS. And so basically, here we are in 2020 launching a new electronic health record, which is Avatar. And so we're going to be going through that today. So again, that was just a little personal background. I've made those CalOMS errors that we've come to be familiar with, and I remember my first experience with Simon, and it was the fact that I was saying I was actually Simon CalOMS. I was saying that there was a legal status. I had to mark legal status on probation, but for the referral, I was putting a self-referral. And that's we all know that's one of the top 5 errors in San Bernardino County. So the good thing about Avatar is that we have at least 2 chances to correct our errors before we submit our data to the state, to the DHCS. So I'm excited about the system. I'm excited for you because as we transition into Avatar and we get used to the flow, if you will, you'll see in a couple of months that it's actually not too bad of a system. And there's just like for me, or anytime there's change, I get a little uncomfortable, but kind of like our resilient clients, we adapt and we move forward, right? So for the agenda, what we're going to do is we're going to go over some basic, I call them Avatar 101 instructions on how to navigate the actual system. And then we're going to go into the initial contact log. And what the initial contact log is that it's a format where we could go in and actually create a client. So my example will be today is that we have a client walking in to one of our county outpatient clinics and is not in the system. And so obviously we're going to create 2 clients, and we're going to see it all the way through from walk-in all the way to the discharge and billing process. That's our goal today. So I'm going to make 2 clients, and then we're going to go through that. And we onboard the client through the initial contact log function in Avatar, which is right here. So we could see we're going to do the call intake initial contact log and assign permanent record number. And then we'll go into the SUD registration bundle. And when we do that, there's the forms that we have to do, the admission outpatient, CalOMS admission, and the emergency contact information. What we're going to do is we're going to see some familiar, I would say some familiar data points, because this process here, the admission outpatient, it actually replaces the Simon the old registration process. So remember, we were doing registration. So this admission outpatient actually replaces the Simon registration. So just remember that. Even though it says outpatient, our residential providers or withdrawal management providers, we're all using the admission outpatient process. And that's a separate form that is on the website. And then we could do that. We could go to the website and get these forms as well. Okay. And then we're going to do the SUD admission bundle, which requires the diagnosis and the SOGI form. And then what we're going to do is do some financial eligibility, something new to us. Not necessarily new, it's just a different process. When we're doing an admission, excuse me, I gotta switch my terminology. When we're doing an admission in Avatar, we're actually doing we're admitting 2 episodes, and that's the CalOMS episode, right? We're gonna open the CalOMS episode. We're also gonna open a what is called an SUD financial episode. That's really important because we're going to put the Medi-Cal guarantor in there so that your billing can start to go through. So very important just to remember that we're doing 2 episodes, okay? And then we're going to do the administrative discharge, standard discharge. For the sake of time, I will just kind of briefly go over the youth discharge, but it's the same concept as the standard discharge where we're actually that we're doing an interview. So with the client. So what we know is the standard discharges is that the client's with us and we're actually doing the CalOMS interview after their treatment, whether they left a little early or they left, let's say, at the exact 90 days. So that's a new. The youth discharge is not new to us, but in Avatar, it's just another step for somebody that's under 18. That's all, and that's the only difference is that the age. And you'll see once you start to practice in there, that the CalOMS youth discharge is almost the same as the standard discharge. Couple of few, I would say about 3 or 4 questions that are not on there, and that's simply because they're youth. But other than that, the concept is the same. Standard discharge, youth discharge, and of course the administrative discharge is when they're not there and we have to close them up. All right, and then we could go over some, updating some client data, and then what my goal is this training was designed for 2 days. So my goal is to go through the CalOMS, take a lunch, and then we're going to do the client charge input, what we know as CDI entry. And so I'll show you how to enter individual services, a couple of treatment plan services, and then the group. And then that should take us into our last break. We're going to do what is called a client ledger, and you're going to see how all our work today kind of comes together in the client ledger, from admission to discharge to entering services. So that's here on the client ledger. It's an actual report. And then since this is a contract agency training, we're not going to go over the scheduler or the group management because that's another function that we're utilizing in Avatar that you won't have as far as the scheduler is concerned. So that's more for the DBH SUDRS providers. Okay, so we're going to skip that, and then I'm going to show you the reports and how you guys can run reports in the Avatar system. So that's a long list of reports. I doubt if we'll get to all of them. And just a disclaimer, we are in what I call the cloud train environment in Avatar. So some of these functions that I just mentioned, they're not, if you will, not available in the test system. but we could show you a couple of reports, and then you'll definitely have access to this list of reports here, so that we could practice. One of the more common popular reports that I'll show you is the MHS or ADS 140, right? The face sheets. Um, the the BHMIS team worked really hard on these reports, and on the 140, you'll see that it's a little bit, I would say, more enhanced, if you will, enhanced. And we'll get to that at the end of the day. Hopefully, all our episodes will go through and we'll be able to see that end report. I'm going to be referring to this document here throughout the day. I will make this available to you. It's something that I put together. We actually started these trainings in April, and so throughout the months, I realized that I need to put together a little cheat sheet for myself, because uh, the steps to get from beginning to end, sometimes I forget myself. Actually, the last training, I forgot a step in the financial eligibility process, and hopefully I learned from that. So what I did is I created this document here, and I'm more than willing to share it with you. I am going to make it official, but for right now, I just say that I lent it, that you borrowed it from Paul, and we could go from there. Uh, so if you could say, I just gave you this kind of steps here. We're going to start with the initial contact bundle. Um, One thing that I want to say is that we need to check to see if there's a Simon number, an existing Simon number that came in from the other system, Simon. And so what we don't want to do is create an avatar number, right? Through this assigned permanent medical record number. This is how you create a number in in Avatar. But we don't want to create that one in Avatar, and they've had a Simon number per the past few years. So it's kind of like our social security number or our driver's license number. We it it'll cause us trouble if we have two. So I'll show you how to do that as well. And then here's the steps. Just like I said, the SUD registration bundle, admission bundle, the eligibility process. It's kind of, I would call this like in detail what you need to do, right? And then we could go from there. At the end, what we do is we do a 270 request. Just get familiar with that term, because that's how you run Medi-Cal eligibility in Avatar, and that's through the real-time 270 request there. And that is included in the SUD eligibility process, right? So I just repeated myself a couple of times on what we're about to do, but I wanted to show you, I have some documents for you as well. You're probably wondering, when do we get to Avatar? One more document I would like to show you, because it's really important that we understand the new terminology. And so on this document here, we could see that things have changed in Avatar. And so what we used to use Z2, Z3, and Z4 when it wasn't, not applicable or declined to the state and unable to answer. We used to put a Z in front of that in Simon, right? For those of us who've got familiar with Simon or have done CalOMS a few times, are familiar with the Z2, Z3 process. And so in Avatar, we actually have to type in the entire number as it pertains to CalOMS on a state level, right? So instead of Z2, we're going to type in 99902. And that's actually, it's always been that way. It's just that San Bernardino County and Simon created a shortcut. So again, Z2, what used to be Z2 is now 99902. Okay? Uh, just like, I would say that's like the major difference in from Simon to Avatar, is that right there. And so we're still going to be using your reporting units, right? So when we're opening clients, we're going to see that we're going to be using your reporting units. And this is a job aid that we created for you. And so we could just use it. Our goal is to complete everything that's in red in Avatar. Some of the fields in the test system are not red, but I'll show you which ones they are. So when it's red, that's our signal to complete those sections, okay? And you'll see when I get to the demonstration. I want to go to the last page. Again, this is everything that we're going to go over today. And I gave you some points of emphasis as well for Avatar. Again, the 9902, when you're doing a driver's license number, I'll do an example of a client that doesn't have a driver's license number or social security number. And so we want to be careful when we're typing in the mother's name in Avatar, and then we don't want to put a space after that. I learned the hard way. I have a habit of typing something and then automatically hitting the space bar, and that was causing me problems in Avatar data entry. So we want to don't put a space after names, okay? And so what we're going to do, and I'm going to go over the special services contract, and then make sure that unless you are a withdrawal management program where it says medication prescribed, we want to put no on that field. That's caused a lot of errors throughout the past few years. And so, like, let's say it's withdrawal management program. Yes, that's because you're prescribing methadone, and the CalOM system is set up that way. So you put yes on medication. But if I work at RBATS, I'm going to put no because the state doesn't recognize me as a withdrawal management program. Okay, so just be careful about that. So let me go back to this, and then here we go. We are going to start with the Avatar demonstration with the initial contact bundle. One thing if you're on a laptop, you can see that the screen is kind of small. One thing I learned about WebEx is if you hover over here to the left of your screen, I can't see your screen, but over here to the left, you'll see that there's a plus and minus, kind of like a plus and minus option over here. It's like a button. And so if you see that on the left of your screen, kind of hover over it if you can't see it. And it's kind of like, it's not grayed out, but it's light. It's a light font. You could zoom in to your screen so this avatar screen won't be. So I can't do it for you. You're going to have to do it on your own and find it on your own. So just kind of hover over here to the left and you'll see the plus and minus signal there. And if you want to make it smaller, that's fine. But again, it's going to be a little difficult to see the screen when I'm doing the demonstration. So again, plus and minus to enlarge the WebEx screen is over here to the left. Hopefully you found it. Okay, so again, client walks in, right? Wants to enter outpatient SUD treatment. So the first thing we need to do is get them into the system. And that is done through the initial contact bundle. So in my search forms here, actually, let me take a step back. And I just wanted to show you a couple of things that your avatar probably looks like this. Your avatar probably looks like this. And so what I could do is I could just minimize. Do you see how I'm minimizing these screens here? And so I can make my my list a little user friendly. Do you see that? You don't have to have all these things open. See that? You could just kind of personalize your screen a little bit. And if you really need those, you can see down here that the tabs are here. Okay, so if you need to pull them back, you're down here. So I'll stay on this. Most of you have the home view billing option, so I will get out of my front desk view and stay within here. And so Just wanted to show you that you could use the help function up here. And if you go to these documents here, what it'll do is it'll take you to the avatar, what is called the wiki page. So there's the avatar CalPM up here and the appointment scheduling. And if you get to the wiki page, there's a lot of resources on how to navigate the avatar system. Okay, so you can get to the NetSmart homepage. Just make sure you're going to Avatar California Project Management, which is PM right there. All right, so that will take you to the website. So it's a good resource in addition to our job aids. So there you go. There's you can see there's no clients here. There's no clients. That's because, and there's no recent forms because I haven't called the forms yet. Now, when you get into a recent form, which is here, you can actually drag it, and you can see that I already have form. Just because I use these forms almost every day, and so will you. So you don't have to search for the form all the time. You'll have them in your My Forms. So if you just so we're going to start with the initial contact bundle, okay? We can just type in, all I needed to do was type in INI. You could type in the whole thing, initial, or like I said, it's kind of quick. So if I just type in INI, you'll see that it dropped down right there, initial contact bundle. Okay, so I'm going to go ahead and click on it. And I can't zoom into my screen yet, so hopefully you found the section to, the tool to zoom into the screen. But once I type in initial contact bundle and I double click on it, it's going to ask me for some demographics. The general rule to creating a new client or searching for a client is that you have to meet 3 items, 3 criteria on here. So usually we want to do last name, first name, and gender. Or you could type in last name, first name, or date of birth, social security, but it has to be 3 things, okay? 3 items to search for a client or enter a new client. And again, we're starting with the initial contact bundle, okay? So for today, I'm going to use the last name training. And then I don't think we used Eric, so we'll use Eric today. And then, so there's my 3 criteria, male, Eric, and training. And then what we want to do is we want to search. So you can see there's no matches found. That means that there's not a client in the system that's named Eric Training, okay? So we're just going to press OK, because we already know that. But for, just for the demonstration purpose, press OK. And then down here, we want to say new client, right? And then that's our cue to start the process. So we're going into the initial contact bundle, and all we want to do is, at this point, we want to complete the items that are in red. So this is where I'm going to try to zoom in a little bit. And again, hopefully you found the zoom as well. Hopefully that was a little better for you. I think I could do it one more time, but then we're losing what we're seeing here. So let me just go back one more time. Right there. All right. So initial contact bundle, contact method. We can just say that it was a walk-in, right? There's his name already. And then for the contact type, you could put self, because Eric walked in. And the call date for this brings up the calendar here. Or you could press today. And today, or the year. So then the call time is current, right? And then it's you have an option here. These are options that we share with our mental health and crisis and field-based programs. So since it's SUD client call. No, it's not an actual call, but he walked in. But for the purposes of training, just know that you have to go through this process to onboard a client. So just complete the red fields and press submit here. You don't want to X out because it'll close the form, okay? So remember this, there's submit and then there's the X out. Once you do the X out, it closes the form without submitting, okay? So we're gonna submit. Notice already to the top left, Eric has a key number. It's P3734. And what we want to do, that just means pending. And what we want to do is create a permanent medical record number afterwards. But right now it's in the P status. And what that means is he's not technically assigned an avatar number yet. Okay? Just remember that P. We can't do any services, no CalOMs, nothing in the P number status. We got to get him out of that. All right. So again, these have pre-populated. And so on program type, notice that all these things are not, they're not red. So at this point, I'm not going to be, you can if you want, but at this point, I'm not going to be entering any of this data. I'm just going to be doing the things that are in red for the purposes of training today, okay? So program type, SUDRS, and then for program, I use the RBATS example, which is Rialto Behavioral Addiction Treatment Services, right? And this is where you're going to see your reporting units. All your reporting units should be, emphasis on should be here, okay? Just as a disclaimer, you could see that SUD, financial, RU, or program, we're going to be using that later. And it's always at the bottom of the list. But for right now, we're going to use RBATs, okay? Right here, we typed in RBATs. Priority, let's just say it's a normal appointment. If it was an urgent appointment, you just click urgent. And so contact is beneficiary. What that means is the caller that or the walk-in is an actual client or is it somebody else? So the answer is yes, it's the beneficiary, right? And that's it. That's all that is read on this form. And so what we want to do is submit. Here. Straightforward, right? Pretty simple. All right. Now, remember that Eric, it takes you back to this home screen here. Remember that Eric is in that P status, right? And so what we want to do is search for him so that we could do a permanent medical record number. Just wanted to show you real quick in our example, in my example, actually, we're here. We're right here. We completed all this. He doesn't have assignment number. I already checked. Doesn't have assignment number. Right, we're right here in my example. Okay. And so what I'm going to do now is assign a permanent permanent medical record number, excuse me. And so I'm going to search for the form and I'm going to say assign permanent medical record number, which is right here. Okay. And then it's going to say select the client. And so a general rule is that we want to type in the last name, comma, and the first name. So if I type in training for the last one, and actually, if you just type in training, you could see that it pulled up my examples. And so there he is right here. You could see that Eric still has that P number status right there. So what we want to do is just double click on Eric. And here we are on the assign permanent medical record number. Okay. And so again, there it is. They're on the P status. You could leave it on the P status. Let's say that they walked away. They don't want to come into the program. Next time when they come in, we'll be able to reference them that, okay, so you got this far, but you never made it to the intake. So we could do that as well. Hopefully you guys can see this a little better. And so what we want to do is we want to assign, we want to take them out of the P and assign the record number. So you just click. And it says auto assign and we want to say yes, right? Make sure you write this down when if you're following along because it's easier. So that's training Eric and it's 4108. So you can see the system gave you the number already. And so we want to make sure, again, don't hit the X button. What we want to do is submit it. Okay. It's submitting. And so what you could see here, again, I can't zoom this portion of the avatar screening, but you could see that Eric no longer has that P number status. His number now is 4108. So remember I was telling you about dragging the forms? You could actually put your clients in the recent clients to my clients by doing this. Just grab it, click, and drag it up there. See how Eric is up here now? Same thing with these forms. You just grab the form and put it up here. Yeah, it came right here. It's a little out of order, but you could definitely create folders and we'll go from there. So his number now, remember this, it's 4108. This is not a Simon number. This is the avatar number that we created through the initial contact bundle, right? He didn't have a Simon number. He was a new client, so we had to do a bundle, the initial contact log, and then we assigned a permanent medical record number. I keep on saying medical, so excuse me. So we could see that we've completed this process. I'm going to go through it one more time. Kind of, I believe I wasn't going too fast, but so we're going to do another example. Actually, I need 2 examples for throughout the training today. Okay, so again, if you missed that, Eric's number is 4108. There's other training examples I have here. If you would just go to search clients, you go to search clients down here. And if I just type in training, you can see that there's actually somebody left the P number status there. You can see there's Crystal training, Eric training, Jane, Annabelle, Paul, right? So do me a favor though, let me work with Eric today. If you're following along, you can go ahead and create your own clients, but do me a favor and let me work on the Eric example. That way I could show you opening and closing, admission and discharge, okay? All right, so let's do this one more time, all right? New client, right? Brand new client, walks in, does not have a Simon number, right? This is how I would check actually to see if they have a Simon number. I would go in and I would say, let me see, search clients, type in training. Let me see, let's see for Paul, you could see that I'm going to double click on him and you could see that it's loading it's a little slow. You could see that Paul has a number already, 4083, has some activity, and this is in the chart view. And let me close out and I'll do that again. All I've done was typed in training. Let me see if he has a Simon number first. Typed in training, and I found Paul. Okay, so let's say, all right, so this client is in the system already. Paul is already in the system. I know we're working with Eric as an example. I'm just giving you a side example. As you can see, Paul's already in here, right? He actually has an alias, Pablo Terraces, Pablo Training. So my point is that we will not be giving him, or we won't be assigning a permanent medical record, right? A number. We're not going to do that. We're going to use 4083, which is here, right? He's already in the system. So if you just double click on him, you'll see that he's already in the system. There it is. He has. So again, all we would have to do is skip down. Since he's in the system already, we skip this and we go straight to SUD registration bundle. See how that, hopefully that makes sense, everyone. And again, I did kind of note it right here. Check for a Simon number first. Matter of fact, Simon's still available. I would check Simon too. You know, look for a Simon number, or you could do it the way I did it here. Let me close this out, which is to search the clients here. I would say, safe to say, the majority of people that had a Simon number in our system were transferred from Simon to Avatar. Not all of them made it, not all the clients made it, but the majority did. So we want to make sure that they have an existing number, or we're going to assign a new one. Okay, never don't create two numbers. If you do, I could fix it. You just contact me, put a trouble ticket in. Hey, Paul, I assigned a medical record number on a client and actually had a Simon number. We could fix it. I'm just saying, we don't want to go do that too much because of billing purposes. And again, just remember that it's kind of like our driver's license number. We don't want to have two of those, right? Imagine how much trouble it'll cause if we have two driver's license number, right? Same thing in Avatar. We don't want to have our clients doing two numbers there. So I'm going to pause, step back, and we're going to go through another example, and we're going to see the process again. New client walks in. Here we go. All right. Does not have an existing Simon number. Brand new client. Okay. All right. Last training, I refer to my document very often. So, and again, I'll give this to you. Let me give this to you. It was lend it to you, right? I'm gonna lend it to you. This is what we're doing here. One more time. So, as you can see, my forms are already up here, so I don't have to type it in again. So I'm going to do initial contact log bundle. Oops, there's a mistake. What happened was that I had Paul highlighted in Avatar, and I'll show you how I've done that. You see how Paul's green right here? It's highlighted. And so since it was highlighted and I clicked initial contact bundle, it actually came up. And so we don't want to do that. So we're just going to, but that's actually something, not a mistake, but an example of when you call a new form, when you want to do a new form, and if your client's highlighted here, it'll actually do a bundle or attempt to do a bundle with the client you have highlighted. So I'm just gonna, and what you do is you simply click once. You see that? If you just click once, it highlights or unhighlights it. Right? So, and then our tab, do you see I open up this tab? He's up here. Paul's up here. Let me cancel that. My apologies. All right. Now, let me make sure that he's not highlighted, right? There you go. So now the system, if you will, is clear. Now we want to do initial contact bundle, new client, does not have Simon number. So I'm going to use the same last name. We'll do training, Lisa, and then female, right? Remember our three criteria. If I had the date of birth, I would put the date of birth, and then we're going to do search. No matches found. We know that. This is expected. That's because it's a new client. So what we're going to do is go down here. Don't forget to go to new client. All right, and that should take us to that first form. I will remember to zoom in, or it might have, it already remembers, right? All right, so again, contact method was a walk-in. If it wasn't a walk-in, you have to, I know we're supposed to take things as they are spelled out for us, but sometimes we don't have that option. So this is just a process to get to that medical record number. So we'll just say that it's a walk-in, right? Contact type is self. If somebody else called, this is how we mark it accordingly. But I'm going to stick with today as a self example, a walk-in. You could let's see what happens. Call date. Let's just put it like a week. It was actually on Monday they called. You see that? Just type in Monday. Today. Just press the T. I believe this is yesterday for the Y. Let's do Monday. right? Current time and program SUD claim. That's it. Straightforward. This is actually how we're going to collect our EQRO data as well by using this form. And we'll get there, guys. We'll get there. This is we're only what, a month and a half into the system. So, be patient with me and we'll get through all this. But you can see up here, Lisa now has that P number that I talked about. We want to do the red fields on this initial contact log. So we're going to do program type, SUDRS. The program, I'll stick with RBATs. Just remember your RUs are down here. And so is that SUD financial. I'm not going to do anything that's in red because it doesn't transfer over yet. So I would say at this point, keep it simple. You could use this if you like. Eventually, you are going to have to use it. Normal, priority is normal. Yes, that's a beneficiary, right? That's it. Remember to submit it. You could see that P number is still there. Doesn't come up on our examples yet, though. So if you're following along, we've completed this process here. Now we're going to assign that record number. So call the form, which is here. Call it up. Assign permanent medical record number. Type in training to bring Lisa. We could find Lisa. Here she is right here. Double click. And that takes us to the form. Again, just a point of emphasis that it is still on P until we click, there it is again. And then we want to assign permanent medical record number. Click yes. Auto assign, we want to say yes. That just gives us a random number, right? When you always want to write it down. And it's her name's Lisa Training. And when I click submit, it should come up on our recent clients as well. Click submit. Awesome. You can see there's we've created Lisa now, so it's 14110. And the only thing I asked today, after I open them up, if you want to do some billing on it, you can. But let me work with the admission and the discharge, and you could submit billing if you want on the examples that end with training. And so I'm going to grab the bar that's green and just put it up here to recent my clients. And that's how I do it. And so there's Paul. Paul's a good example of what's going on in Avatar training environment, is that I've already created that 4083 number. So I don't want to, give them another number by clicking assign permanent broker. I don't want to do that. He's existing already. Okay. That is a straightforward demonstration of how we do an initial contact log bundle in Avatar. Hopefully that was easy to understand. You could see, let me unhighlight Paul here. Matter of fact, what I'm going to do, see how it says recent clients? I don't want to confuse, actually I confused myself. What I'll do is you can remove him from the list by doing this. Right? Have him highlighted, right click, remove from list. Let's get Paul out of there. That way there won't be too much confusion for me. So today we're going to work with these examples up here. We're doing Lisa examples and then the Eric training example, which is right here. You can see each time I click over here, it's, there's some activity over here, and you can see the Lisa training. There's the ID. And once we get all the data, here, we're going to see more activity on this client demographic with update. And you can see there's no client episodes yet either. So that's what we're going to work on next. There's a message center. I'm just going to minimize that as well. Again, you guys can customize your screen. See that? Let me see where I'm at on the agenda. We went over the widgets, kind of like my forms, initial contact log. Looking at the time, my goal is to take a break, like in about an hour. At this point, Eric, are you available?
I am, Paul. Sorry, I was responding to an email.
Okay. So we're at 9 o'clock and we did the initial contact log, the bundle. I'm not sure if there's too much questions about it.
I do not see most of my questions in the chat have been around there,
Okay.
around Avatar.
Uh-huh. Are we
So
good?
I do not see any questions. But if you guys do have questions, like I said, I highly encourage you to put them in the chat so that we can address them.
I've seen a question. Can you hear me? There was a, can you guys hear me?
Is this Nakia?
Yes.
Yay. Hey, how's it going?
Good. It's going well. There was a question, is the permanent MR number the same thing as assignment number?
Yes.
Well, we're not using assignment anymore, but is it the same thing?
Concept is the same. The concept.
Okay.
So meaning that just like when you use Simon and it automatically generates the number, the permanent number is now referred to as generated in Avatar. And so it still serves as the client number, the chart number, however you want to refer to it. But like Paul said, the concept is the same. Obviously, they're not the same. There's a different process for if they exist in Simon as opposed to if they're a new client in Avatar.
Okay.
Okay. So we're going to keep going then. And again, my goal is to stop around 9 o'clock and see where we're at. And then we'll go from there, okay? At this point, if you are following along, if you have created the clients, that's great. We're going to have plenty of time to test. We're still going to have access to the test environment. I would recommend that you take notes and just kind of watch what I'm doing on the screen, and then we'll practice later. That's just a recommendation. But if you want to follow along, that's fine as well. The reason why I say that is because actually that's kind of like me. That I'm a learner who needs to watch first, do examples first. Trust me, especially when it comes to algebra. I gotta like literally watch videos, look at the professor, and just literally. Matter of fact, there was a point where I wasn't even taking notes anymore. I was just watching. So if you're that type of learner, if you're not, you can just follow along as well. Okay. So let's go to the Paul's instructions here. I'm gonna go ahead and how's that? That should be better. What we're gonna do is we're moving out of the initial contact log bundle, and now we are going to create openings. Right? We used to call them openings. In Avatar, we actually call them admissions. Right? Episode admissions. We're going to continue to open an episode, admit an episode, and close it in CalOMS, right? Just a disclaimer before I forget. This SUD episode that I'm talking about, SUD financial episode, just for FYI, this one always remains open. We never close the SUD financial episode. All right. So if you're taking notes, just remember this financial episode here always stays open. But we do, if you will, admit and discharge our SUD programs episodes as well. Okay. So this is where we're at. We did the initial contact log bundle. Now we're going to go into SUD registration bundle. That transitions us to the SUD admission bundle. Two different concepts there. Okay. All right. So let's get started. And so we'll start with Eric. And so in our search forms, right? Search forms, we're going to type in SUD registration. I just typed in SUD reg, and you see how it comes up. If you don't want to, you don't have to type in the whole thing. One more time. SUD, and then there's the registration bundle here. All right. Let me go back. What I did is that I have Eric highlighted up here. If I don't have him highlighted, what's going to happen is the SUD registration bundle is going to ask me for a name or a client. But if we want to work just a little less, just have them highlighted here, just like that. Oops, excuse me. Have the highlighted in green, then type in SUD registration bundle. Right there. And just double click. This should take us to that admission outpatient form that I was talking about. And we have this form on a hard copy. And so what we want to do is we have the counselors fill out the hard copy of the admission outpatient form as well. The reason why I say that is that one, it's going to be for your records, but two, this admission outpatient form that we're looking at replaces the old Simon registration. All right. This replaces the old Simon registration. And again, we do have these forms available. They are in draft form. You have the San Bernardino County DBH permission to use the forms in draft because we're working on the final versions. Literally, as we're going along with this training, we've gotten a lot of feedback from providers on how to enhance the forms. And once we get the final version, we'll get them out to you. All right. So let's start here. Admission outpatient form. I'm just gonna pick a random social security number, and then in the other example, I will make it where they didn't have a social security number. What happens? It does happen, though, right? The genders, the age. You see how things have already transferred over here. So, and then I'm going to use the calendar and drop down the year for the date of birth. And if I click out, date of birth, click out, or tab, I like to click out. The age is already populated there. Do you see that? And so then, and on the admission date, I'm going to keep it simple today, guys, and I'm going to use today as the admission date. And then maybe on another example, I will backdate it a little bit so that we can see how the billing works, okay? So admission date, you just press today, current time, and then, like I said on program, your RUs are going to be here. So if you just drop down, wheel down, if you will, you just pick your RU in program. At this point, what I like to do is I like to work from left to right. If you start over here, the system for some reason kicks you out. So kicks you out of the form, and it requires you to go back to the left if you start on this side. So we want to, do these red admission fields as well. So it's an SUD admission. And then for the practitioner, that's the counselor or whatever staff member that is actually completing the intake. They do have to have the assignment number though. And I've been using a person by the last name Wells. This is all encrypted, by the way. So they're not I would say their names are encrypted. So it mean there's you're not going to find Paul Terrasses in the test system. So everything is encrypted. I used to use Ellis Wells, but it come to find out she's not approved for SUD services. So I'm going to use Amanda Wells as our number one county counselor, if you will, SUD counselor. So Amanda Wells, that's who we're going to be using for today's admitting practitioner and assigning a diagnosis. If you miss that, all I do is you just kind of like, yeah, I'll just type in let's see, HA, and you could see Harrison. There's some, the Harrison, Barbara Harris. All you got to do this, it literally drops down all our counselors in the system for you. Okay. But for this example, I'm going to use Wells, Amanda Wells. All right. So again, we're going to look for the red fields. That's going to take us to our compliance indicators, which is down here. And so, yes, they receive a copy of the Medi-Cal handbook, right? Notice of privacy practices. They do receive those, and they do receive a consent for treatment. If you're a residential facility or you're a withdrawal management facility, this is avatar language. We can't change it. But we're always getting consent from the clients. So you just want to put yes on that. And then no, they didn't have an advance directive, right? And so we've completed all the red required fields in the admission outpatient form. I am going to zoom out just to make sure. You see how I completed all the forms, all the fields? We've already done that. And if just a reminder, if you could put yourself on mute, that I would appreciate it. So we're going to go back to now that we've completed this form. I call these on the side, I call them bars. So this is like the admission bar over here. Make sure you do that. We've already done this. Now we're going to go to the demographic bar down here, right? The admission bar. It doesn't do it automatically. You have to actually call it. You got to like click on it. Just remember that it's over here. I call them bars, the demographic bar and the admission bar. So we're going to enter the address. I'm just going to put the program address. Okay. Remember not to put spaces. I have a bad habit of that. It's not a bad habit. It's just a habit. And so, and then on the zip code, Avatar is linked to a system that knows zip codes. So all I have to do is press the zip code and tab out or click out. You see that? It already populated San Bernardino County, Rialto. All you got to do is type in an address. I mean, a zip code, excuse me. See that? It all things for you. So, client home number. You do that. You could type in these work or the address of the cell phone. These are not read. In the live environment, this is actually a CalOMS question. The handbook says that we have to answer this. So in the live environment, this will be read. So are you heterosexual, lesbian, gay, bisexual, transgender, or do you question your sexual orientation, right? This is going to be required in the live environment. And here, we're going to put an alias because it's common to have alias. And so what you want to do is, let's just say an alias for Eric training would be And then what will happen is you'll be able to see in the live environment, the alias will be up here. You see where I had, like there's a picture, the alias will be up here. So that's how you enter the alias. Okay. Here's some red fields that we haven't filled out yet. Again, we are in the admission outpatient form, working towards that CalOMS admission. Couple of demographics, right? Couple of demographics. You can see these are not required. Education is. Employment status, right? Some of this might look familiar to you already. Again, this replaces the Simon registration. So I've completed all these fields, just making sure there's nothing red down here. We do share this form with mental health. Just want to make sure that the admission field, the admission bar, this is completed as well. RBATS, our program. Everything looks red. Ready to go, excuse me. So again, do not click that red X button because it will close the form and you got to start all over. And everyone's way too busy for that, right? So we're going to press submit. That brings us to the CalOMS admission. Real quick. Remember, we are completing this process here, the SUD registration. We completed admission outpatient. We're working towards this bundle here, okay? So this is gonna look very familiar to some of us because this is that CalOMS admission. We also have this form on hard copy as well. It looks totally different from the old Simon forms. It's no longer a 2-pager where you have to flip it back and forth. It actually in detail has our CalOMS interview questions and answers on our forms. We decided to go that route because of we realized that we get interns, we get SUDRS interns, staff turnover, and if we just continue to have a double-sided form and not proper, our data collection needs to be enhanced. So literally we entered the questions just like this, birth name, and all these other ones over here to the left, all the bars to the left, we put those on our new forms, okay? So we worked pretty hard on them. So hopefully our data will have less errors, right? Again, I didn't make a reference that we're too busy to close out forms and start over. We're also too busy to go back and correct errors that we could prevent. And we're going to do that through enhanced forms and these light bulbs that I'll show you later on. All right, so let's do these demographics. Again, this is a CalOMS now. This is CalOMS data set. This is required from DHCS, right? This might sound familiar to you. Place of birth, the county. The county, let's do San Bernardino County. Here's all the counties in California. If it's an other born out, that's there too, outside of California, right? But we're gonna do San Bernardino County. That's obvious. Let me see what happens if I put Arizona. See that? I put San Bernardino County, but the state was Arizona, right? That's I made a mistake, data entry mistake. A little busy. Phones are ringing. Cell phones ringing, and I put Arizona. One of the benefits of Avatar is that it does give you an error message. It says that you put the county, but the actual birth state is not California. I believe our other systems does not do that for us. Again, I want to present this information as the system is actually helping us collect some, I would say, some clean, some up-to-date data. So we want to go back and put California. Okay. On the driver's license number, let's say they don't have a driver's license number. So what we want to do is we don't want to press Z2 anymore. we want to say not applicable 99902, right? And then on here, one of the common errors was to put California there, and it actually allows you to, but this is an error. If they don't have a driver's license number, we don't want to put a state. So just remember there's a drop down for you, and it is none, not applicable. Okay. It is required that we put a name here. Let's say they didn't have parents or foster parents. If that happens all the time, we could just either put mother or father. Not a veteran. Consent for future contact. Yes, we could. They consent that we could contact them after treatment. On the race fields, these are all CalOMS requirements. There are 5 options to put race, and so what will happen is that it will not allow you to choose 2 at the same time. See that? Where I put other race twice? Can't do that. It'll give you an error. So you could just put you could put any race you can here, but don't try to click on the same ones, like I said on that error. Okay? Making sure that we've completed all this. All this is complete. This pre-populates. You can leave that there. There's that admission. And remember, we're going to go to, now that we've completed all this, we're going to go to the left side, left bars. We need to complete all these. So here we go. You got to click in them. They won't go automatically. This is an admission. So this in the live environment, I believe this is red as well. Click on these left bars. Admission data. Remember I gave you the example where I made my first error in 2003? This is what I did wrong. I had put self-referral, but they were actually on probation, right? So that's an error. So if they were on probation, we'd use this here. Drug court, we got drug court. CFS, this county calls it CFS. We also have the other option as well. So here, we're going to do self-referral. Days entered, days waiting for treatment. We'll just put 5 days. Number of prior, this is again, we're going over the CalOMS admission process. This is the CalOMS admission process, okay? So number of prior episodes, this is in their lifetime, okay? Let's say Eric has been to treatment twice. Prior episodes, this is the 3rd. They are not a CalWORKS recipient, so CalWORKS will not be paying for the treatment, right? So this is where I said that I would go over that special services contract county code. There are times where other counties pay for San Bernardino County treatment. It happens quite often, not. And so what happens is what we want to do is, it usually happens in residential treatment though. But in my example, it's not a special service contract. They are San Bernardino County's paying. I'm just going to put no. And you can see that it already pre-populated these codes here. So let's say they were at Cedar House and Riverside County is paying for their treatment, right? So I would have to put, yes, it's a special service contract. But then that's when I have to say answer these questions. So I would say Riverside, and then special services. I would have to know that contract ID, and only Cedar House would know that special ID, right? It's not something that's public, and so that's just a quick example of that special services contract county code. I believe in Simon, all we did was put a Z2. Today we were going to put no, and see how it populates 99902, not applicable. Okay. Remember, we need a, yes, sir.
Sorry, I thought you was about to pause. Sorry. No, I was just going to point out in the chat, we had 2 questions. One was how did you get to the CalOMS form? And if you could show them the CalOMS process one more time.
Absolutely. That's actually a good question, because if you missed just kind of taking notes, there's a few ways to get to it. So good. So what I'll do is I'll go back to my sheet here, and so what we're gonna do is we're gonna click on an SUD registration bundle. That took us. It's when I say a bundle, trying to think of a good example. It's kind of like when we're filling out an application online, it gives us a first page, enter, second page, and third page. And the same thing with this bundle. It's all kind of literally bundled up for you. So you don't have to be clicking on separate forms when you're in our SUD registration bundle. Yeah. When you're down here on eligibility, financial eligibility, yes, but this is how you get to the CalOMS. And I'll show you. So when I was starting fresh, I get to the question is, how do I get to the CalOMS? How I got there is that I had I had that new client, and I went to the SUD registration bundle, which is right here. SUD registration bundle. And in that bundle, we complete the admission outpatient form and the CalOMS admission that I'm in right now, which is this right here. See where it says CalOMS admission? Hopefully that answers the question. You could get to this form separately. There's a different way to do it, but my suggestion is you always follow the bundle. And the reason why I say that is that I myself, when I was in training, just went straight to CalOMS admission, and I forgot the other steps, and it caused me problems later on. So as you advance as a user, avatar user, you'll see that there's different ways to get to forms. But for right now, let's do the SUD registration bundle, and that's how you get to CalOMS admission. All right. I will go ahead and just continue to move forward. And so, okay, so we've already completed these sections. I believe we just kind of go over here, initial admission, admission data. We've already completed these, and then we're going to do alcohol and drug use, right? And so we're going to see that we need a primary drug code for today. We're going to use alcohol. There's a general rule, and when you use alcohol for the primary or secondary drug code, and that is you have to put, remember we had to put Z2 on the alcohol frequency, which is down here. But you're going to see that if you choose alcohol as a primary drug code, Avatar already does this for you. I would say this was like the number 2 error in San Bernardino County, is that we would put alcohol for primary drug code, and then we would put 30 days or 60 days here. And then the CalOMS rule is if the primary drug is alcohol, we do alcohol frequency is 99902 Z2. Okay. What we could do is this light bulb here is kind of small on your screen, but if you hover over it, it says, what is your primary alcohol or other drug problem? If you click on the light bulb, you can see the screen comes up and it says literally ask, what is your primary alcohol or drug problem? This is new. Our other systems does not have these. It doesn't go, they weren't this advanced. And so this is another way of us helping you to collect your data. Even if you're working in the front office and you're not sure what the counselor put on the form, you can actually use these bulbs to understand, like, oh, okay, this is the primary drug problem. And so these light bulbs are there throughout the whole system, throughout the whole CalOMS. And we appreciate NetSmart working with us and putting those in. Again, one of our main goals is to collect good data enhance our data collection, and not create those errors anymore, so you could focus on your business practices and helping the clients with their issues. So I'm going to keep going with the form. Again, this is the Cal OMS admission form. Primary drug frequency, and it does say the ask is, in the past 30 days, how much have you used your primary drug? And so we'll just say they were drinking every day. You could see that since I put alcohol, it already pre-populated here for me that it was oral, right? I put alcohol, but on these other drugs, it'll do that as well. But for right now, it's not letting me choose any other route of administration. Age of drug of first use, we just put 15. Again, one of the last times I'll say, so that we won't jam up all our time, is that the light bulb is there as well. Right? So on the secondary drug code, these are not read, but they will be read in the live environment. We'll say methamphetamines used every day for the past 30 days. That's the question. Your drug frequency. And then let's say was smoking methamphetamines. And then that started at age 15 as well. IV use, and what this is saying is, in the past 30 days, have you used IVs, right? And so we'll just put 0. And then the same question, but it's saying needle use in the past 12 months. So this is in the past 30 days, and this is in the past 12 months regarding needles. And we'll put no. Okay? Don't forget, we got to complete all these bars over here to the left. So we're going to do employment data next. So have you been enrolled in school? The answer is no. Do you see my education? This already, since we already completed it in the admission outpatient form, it's populated for us and the employment status as well. See? Avatar is actually helping us out. They're kind of populating for us so that we don't have to enter that again. So they were not enrolled in job training. Again, these questions are on the forms. And were you working in the past 30 days? We want to put 0. Okay. Left bars, criminal justice status. Actually, I think I had my chat open, and I saw a question about, is that the alcohol and drug use? Can you answer? Can I just go back on that question, Eric? I think I saw a pop-up about primary and
Definitely, I might have missed it.
It's probably an important question, and I will. I opened it up. What if a client does not have a secondary? Would you use the 9902? And that, okay, that's a good question. Let's do that. Thank you for that question. So the question was that, like, let's say they were only drinking alcohol and no other drugs, right? So you just kind of drop down the menu and use the drop down, and we won't put 99902, which is what we do in other fields. But in this case, we just press none. And everything populates for you. None, 99902 on the frequency, none there, and then none, and then it kind of like Avatar already knows the CalOMS answers when you're putting none or not applicable, right? So you see if you put in a drug on a secondary, it requires you to enter the red field. But that's an excellent question, excellent example. Glad it, for some reason, the chat popped up there, and so we'll go on from there. Good question. All right. We'll go on.
Oh, you got one more that just popped up.
Okay.
If client is courtesy dose from another county, do we enter yes under special services?
If the other county is paying for it, you have to press, you have to do the the Special Services Contract County Code. Here. If another county, the rule is if let's say Riverside County is paying for treatment and you have an episode in San Bernardino County, you would put that. All right. I guess the question would be, are you opening a new episode? Right? Are you opening, do they have an episode open in Riverside County? And are you opening an episode over here in San Bernardino County? Those are two separate episodes there. So that might help as well. Again, the rule is that if another county is paying for treatment, you click yes. You have to know the code, right? Riverside County code. And then you have to have this special contract ID as well. That could be something that you could get through your program coordinator, maybe fiscal. All right. These are actually good questions. So I'm going to leave it at no, though, because I don't know the ID code. All right. So where were we? Did we do employment data already? Remember our left bars? We'll go to criminal justice status. And so since, remember my error in 2003? I had put my admission data, I had put self-referral, but on the criminal justice status, I had put that they were on probation. So that can't happen. So since they are a self-referral, what we're going to do is we're going to say no criminal justice involvement. Okay. Now there's opportunities later to clarify what that. And I think with our other example, what I'll do is I'll do probation case, and then we can use that as an example. Okay. So for now, it was a self-referral, no criminal justice status, and then you can see that the CDC identification number has populated to 99902. Number of arrests in the past 30 days, we would say no. Number of days in jail, that's 0. And then number of prison days in the past 30 days, and that's 0 as well, okay? Again, these are interviews this is an interview question that we're asking the client. Since we no longer have a contract with PSN in this county, PSN question is always going to be no, and we no longer have a contract for FOTEP as well. So these are always going to be no. You can see if you put it populated no, and it's going to say no here. And so I just wanted to kind of make that clear, is that when we're doing this, these are always going to be no, and that CDC number, that yes, they might be on active parole. That's fine. We don't want to put the CDC number in here because this is connected to PSN. PSN and CDC, those two concepts are the same. So this is the way you're going to see it all the time. No, no, no on FOTEP, and no on the CDC number. I can't remember the year that we no longer had that PSN or FOTEP contract. I want to say it was around 2010. So, but what happens is that CalOMS and DHCS left the data set the way it is. They didn't say, okay, we no longer have a contract with parole with PSN. We no longer have a contract with FOTEP. They left the questions there. And I believe it's for historical purposes. So when we move forward, current time, we're just going to put no on this and 99902 here on the CDC number. This is for that legal status, okay? So we're moving on. Medical and physical. Yes, they're Medi-Cal. And did they go to the room in the past, emergency room in the past 30 days? We put 0. Have they been in the hospital in the past 30 days? 0. And then we could put 1. Let's just say they reported some pain in their back. And so they would say for medical problems in the past 30 days, it would be that 1. So we could say that pain in their lower back. Okay. Since it's a male, this pre-populates to no. And since we're in RBATs, we're going to say none. Again, this is where if you are a withdrawal management program, what will happen is you're going to be able to use these options. And I believe since I was in RBATS, you could see again, this is where Avatar is going to help us out. Is that we don't. There's the ED Bridge program, which we're not going to get into, but let's just say that RBATS, our county clinic, is not set up for this type of medication. So it's always going to be none for RBATS, right? So even though I tried it, that's the error that it's giving me. So we're going to press none on medication as part of treatment. Okay. Again, withdrawal management programs will have that capability. And then have you been diagnosed with tuberculosis? This is what we ask them. Have you been diagnosed with hepatitis C? Have you been diagnosed with any STDs, right? We're going to put no. And then here, these are the careful questions that we train our counselors to ask. And that's, have you ever been HIV tested? And if they say yes, and then what we want to say on the results is, we don't want to know the results, but did you obtain the results at any time? So just say, yes, I obtained the results. So we train our counselors to ask these very delicately. This is just part of a training issue. Okay, left bars, we're going to go to mental illness. We're here. No mental illness. Have you been in an emergency room due to a mental health issue? So we're going to say no. Have you been in a psychiatric facility because of a mental health issue? No. No on the mental health medication, right? Don't forget your light bulbs. Last one. Family social data, the left bars. We're almost done, right? See how this? We're almost done with these questions here. So this is for social support. If you really want to ask the question, it's a lengthy question because it says in the past 30 days, have you been to 12-step meetings, religious faith recovery, self-help, family members, friend or support. The way that Avatar is set up, there's literally not too much room here. You'll see in the discharge form, they actually put it in. But for here, social support, you could hover over that light bulb and you could click on the icon as well. Okay. We did put it on our forms though. So we'll say, let's say there was 5 days of family support and they were homeless, current living arrangement. Are you living with somebody that is abusing drugs or alcohol? You could say yes. In 30 days, I was, homeless or living. Everywhere I went, everyone was using drugs and alcohol. And then conflict in the past 30 days with family. They can say, oh, I would say 10 days I had conflict with family. And then number of children. Let's say they don't have any children, you could just press 0 and then click out or tab out, press the tab button, and it'll populate for you, right? So we did put light bulbs here because sometimes, let's say we have a CFS client that let's say they have a newborn and the child is living with, let's say, the grandparents, right? So this client would say, well, let me deselect them. Let's say they're like, okay, yes, I have a newborn, but they're living with the grandparents. All right, so number of children, 17 or younger, 1. 5 or younger, yeah, that's age 5 or younger, that's a newborn. So we put yes, number 1 here. And then living with somebody else, yes. But we want to put 0 here because first of all, it's only the one child they're reporting, but the parental rights have not been terminated, right? This is where a CFS case has gone to the extreme, and this happens for our clients as well. But for right now, this is an example of a child the newborn living with somebody else. Okay. for the purposes of training, let me do this. Let me erase this. And let's say I forgot to enter that information there. But you can see over here to the left, we went through all these data sets already, right? We went through all these, and now we're ready to submit. Remember, don't press that red X because it closes out the form without submitting. We're gonna do submit, but Paul forgot to put this. Let me do another one just so I could. Let me erase this as well. Let's say we kind of skipped over it, okay? Skipped over it. We were here, we thought we were ready to submit, and so we want to submit. One of the benefits of AVATAR is that it's asking us to correct our errors. What would happen is in our other system, we were allowed to tab through the whole thing and submit with errors. And I don't know, maybe your new staff or current staff that's worked in a program before, these are when we have to contact you a month and a half later and say, hey, can you go through the spreadsheet and correct these errors? So this is what I was trying to mention earlier, is that AVATAR allows you to go through the data set, and even if you miss something, if you make an error, if you made an error, you are prompted to say you have another chance to correct them. So I would say this is one of the main benefits from this system. So what we just want to say is okay, and then we want to go back and see how there's a red flag here. We actually want to go back and correct the error. There's a red flag over here too. See that? Red flag. Now we want to put 15. Now we could submit it. Okay, so for those of you who are following along, we just finished that CalOMS admission. And so for the emergency contact name, if they don't have an emergency contact, which is common, what we want to do is just press the red X. But for here, for the purposes of training, we could just say the emergency contact was emergency contact name was Paul, training, friend, and these are not red, so we could just, let's just say that they only had the phone number, right? Enter as much information as you get. So, and that's how you do the emergency contact information. Press submit. It's going to bring us back to our home screen. That's because we completed the SUD registration bundle. We've completed the admission outpatient form, the CalOMS admission, and the emergency contact information. So that brings me to where am I at in time? 9:45. All right, we're going to take a break. We're going to take a break at 10. So what I'm going to do is I'm going to go through that one more time with our other client, and then we'll take a break at 10. And then when we get back from break, we will do the admission bundle, right? So that we could have CalOMS fresh on our mind. So we've already completed the intake with Eric, and you could see that we're getting more data now, right? Look at down here on the episode number. Remember, it was this for Lisa because we haven't completed it yet, blank. But if we look at Eric's example, you can see down here, we have an episode. Missing diagnosis, we haven't got there yet. Okay, so I'm going to go through that process. I'm not going to be as detailed in my example, but maybe a good time to just put your pen down and just watch me go through that bundle one more time. Okay, so here we go. We've assigned a medical record number. We know the medical record number for Lisa. And so what we want to do is go have her highlighted in green. And we're going to go to the SUD registration bundle. Okay. That takes us to the admission outpatient form. And this replaces the Simon registration. And so in this case, Lisa doesn't have a social security number. So we just use the nines, right? Use the nines. It will allow us to do that. And the date of birth, just drop down to date of birth, tab out. Remember I said I was going to backdate a little bit. So just let me write this down, that it was on the August 10th was the opening date, current time, and the program is 3601. Okay. Left to right, we're doing SUD admission, and the admitting practitioner was Amanda Wells. Again, I'm just going to go through these if you just want to kind of like follow my example here. We know from the other example that there's fields down here in red, which is the compliance indicators. Yes. The notice of privacy practices and the consent is yes. There is no advance directive. You could actually type in your intake note here as well. Right? About advance directive. And so our left bar, this completes, everything else is in red. It's not in red, it's already completed. So remember our left bars, don't forget, we have some more work to do on the demographics. And then we'll just put RBATs, excuse me. Type in the zip code. Again, this is the admission outpatient form. It types, it goes for us, and then the phone number. Right. You see this error here. What did I do wrong? Oh, I put a zero little. There's another, again, another avatar error message there, which is good. See the zero here? Should probably slow down, but I'm trying to get to that break. All right, there you go. Language. Again, I'm going to go through this fairly quick. That one's not red. The education, right? Make sure there's nothing red down here. This one, this question will be read in CalOMS. No alias. We'll leave the alias blank this time. Okay. Again, SUD registration bundle. This is the number one form, the admission outpatient. I've already completed all this, so I'm going to submit it. That's going to take us to the CalOMS admission. Fairly quickly, I'll just go through these. Let's say that the counselor already filled out the paperwork, so I already have these answers. And you could see this is the social security number is blank. We did put 99902 on the admission form. I'm sorry, 999. We'll use the nines for the social security number because they don't have them. Just remember that we have to put 99902 for CalOMS. Okay? No driver's license number either. This happens all the time, actually. So we don't want to put California. We want to put none. no space. I learned to take my thumb off that space bar. So we're going to do no, consent, and then we're just going to put other race, okay? Again, this is the CalOMS data set. Don't forget, we have all this stuff to complete on these left bars. It's the initial admission, and then admission data. Let's say this time they were on probation. So I would click here, probation. They didn't wait any days for treatment. So, and then number of prior episodes is 0, first time entering treatment. No on the CalWorks. There's no CalWorks funding for this client. And then remember, my screen is zoomed in, but you have to remember that the special service contract is down here. And you just want to press, like if you try to click, it doesn't let you. I'm clicking, it doesn't let me. But you just want to press no on the special services county contract code. And we'll put methamphetamines they used every day. Let's say they were smoking methamphetamines. The age of first use was 15. And then like our example, good question. There is no other drug, so we put none. And that populates all these other items here. Alcohol frequency in the past 30 days, no alcohol. In the past 30 days, IV use, the answer is no, they don't use IVs. And then in the past year, none at all. That's where you press no here. Okay. Employment data. They're not enrolled in school. See my demographics here? They already populated. Not in job training. Work in the past 30 days. Let's say, yes, they've worked 5 days out of the past 30 days. Criminal justice status. You could see, what did I say on the admission? That they were okay? Real quick. I did put that they're on probation, right? So here, on criminal justice data, I wouldn't put this, because it's saying that's impossible. You just said that you were on probation, they were on probation, but now you're putting no criminal justice involvement. Number one error, San Bernardino County past few years. And again, Avatar is allowing us to correct it before we submit it. So we're just gonna say on probation right there, okay? Always no on PSN, always no on FOTEP. Always 99902. Even yes, they had a parole number or they have one, they're about to discharge it. But for the purposes of, for us, San Bernardino County, CalOMS, Avatar data entry, please do me the favor. Always no over here on FOTEP and PSN, always 9902 here. They haven't been in jail, so no arrest. Again, I'm going pretty quick just to show you. Counselor already gave me the form, and I already have this data. On my other example, I was actually doing interview questions, which is fine, but I'm just doing data entry. Yes, for Medi-Cal. No emergency room or hospital. No medical problems. It's Lisa, obviously a female, right? And so we could just say, not sure on the pregnancy. This is an RBATS episode. So we're going to put none on medication, right? If we try to do methadone, we're not qualified for that at RBATS. So we press none. For have they been diagnosed with TB? No. Hepatitis C? No. STDs? No. And let's say for this time that they didn't get HIV tested ever, and you could see it populated for me. On the mental illness, that would be no. Right? They didn't go to the emergency room or a psychiatric facility. No mental health medication. That takes me to the last one, family social data. Let's just say there was no recovery support at all, 0. Client is living with somebody, but they are using drugs. Living with somebody that has used drugs, 30 days. Conflict with family, an extreme example, 30 days. Let's say that, again, that example of that newborn has been taken to the CFS I'm sorry, let's just say they live with the grandparents. Newborn. Age of number of children, 1. The age, 5 or younger, yes. Living with grandparents, 1. But we still have those parental rights, right? So we'll put 0 here. Submit. I believe I filled out all the information. And let's say this client absolutely does not have any emergency contact information and does not want to give us any information. That happens all the time, and that's totally fine. So instead of pressing submit, we could just hit the red X here. The answer is yes. And there you go. You could see now that I have Lisa highlighted up here. Now there's that episode that we just opened. Okay.
Paul, there's a couple of questions in the chat.
Yeah.
So
Before
one
we
of
go
them
on,
is like, do we input CDC number if client is an inmate?
The answer is no. We don't have a PSN contract, and that CalOMS data set is connected. CDC and PSN is connected, so we would put no. Always. I wish it would populate where we couldn't, there was no question, but unfortunately we have to do it ourselves, so we would just put no. Good question.
And there was another question, but I didn't, or maybe that was answered because it's related. It said, what if patient is incarcerated? But I'm not sure what point in that processing was that question referring to. Or Stephanie, if you can let me know if he answered it with the CDC number. Yeah,
so we're always going to put 99902 and no on PSN, no on FOTEC. If the client is incarcerated, same concept. We're going to put no on that CDC number. Good questions. And again, we're here at the SUD diagnosis. So we've done initial contact logs. We created 2 clients, and we did a couple of SUD admission bundles. Registration bundles. Next is to do the admission bundle and then that financial episode. So it's exactly 10 o'clock though.
And then one last question, what's an advanced directive?
It's where a client has a kind of like a legal document to, if they pass away, and what they do is they give instructions, like medical instructions, like if they don't want to be put on a respirator.
Resurrected or revived. I mean, not resurrected. Revived. Right.
Like, I've been doing treatment for a couple of years, and I think I've only had a handful of clients tell me they have an advanced directive. Like, it hasn't been too much. So all good questions.
So we're right on track for a break right now?
Yes, sir.
All right, everybody, let's take a 15-minute break and we will reconvene at 10:15. Thanks, Paul. Doing great.
Okay. I'm going to mute myself and I'll be back in a couple of minutes.
Hitting record now. You're good.
Okay, welcome back, everybody. Just a quick review before we get into the SUD admission bundle. We completed the initial contact log bundle. The clients, they did not have assignment number, right? They didn't have assignment number. So what we did is we came back and we went into the initial contact log bundle. We completed the call intake form, initial contact log, few red fields there. We submitted the form. We actually did this twice, right? And then they were in the P status. pending status. And so what we did was we assigned a permanent medical record number, right? So that concluded those initial contact log bundles. And just for your information, you could use the initial contact log as much as you need. If clients are calling in and you could, and if they're already in the system, by all means, click on their name, do an initial contact log, a contact log, and that's how you're going to create your EQRO data. Is that if you just, it's unlimited. I tried like, I don't know, I think the most I tried was like 30 times, and I was able to collect all that data. Each time a client calls in, wants to make an appointment, you could use that multiple times. Okay. And then don't forget to assign the medical record number. Don't leave it in that P status. So then we did the SUD registration bundle. To us, who've been around for a little bit, we used to call it the opening, right? We used to call it the opening. And so we did a couple of those. We did the SUD registration bundle. We did 2 admission outpatient forms, 2 CalOMS admissions, and 2 emergency contact information. Our examples were Eric training and Lisa training. And so now we're going through my step-by-step. And again, I'm going to get this to you, get this form to you. Now we're going to get to the admission, the SUD admission bundle, and that will take us, let me get here. We're going to go to this is where we're at now. We're going to do the admission, SUD admission bundle, then the SUD financial eligibility process. That should take us into our lunchtime. Okay. And if somebody wants to remind me to make sure I follow my own directions, because I usually get ahead of myself when I skip these steps right here. So one more quick time, we transition out of here. We did all this, and now we're here. Okay. So we have Eric highlighted. We have the client highlighted, and we're going to do search forms, right? Yes, I have the bundles up here. You could see that I created forms already. I created these bundles. You could click edit. You could remove them, save them, right? But for the training purposes, I'm gonna have the Eric highlighted. Click on SUD, and then it's admission bundle, right? So I just literally typed SUDA, and it dropped down for me. Okay, work less. Sometimes it's good. Click on it, and this is the SUD admission bundle. It's gonna open up the diagnosis, and so you could see that this is the diagnosis page right here, and you could see that our episode is here. Sometimes a client is going to have multiple episodes, and it'll reflect here, but always make sure that you're working with your episode, which is this one here. It's kind of easy because this is the only one. Double click, or you could press OK down here. Either way will work. Again, this is the SUD admission bundle. So the type of diagnosis is going to be the admission, and you'll notice that it's going to populate that day of the intake, which is 8/19, that first day of intake. The time, we can put current. I feel compelled to minimize my screen a little bit, but just know there's information over here too, but this is not red. But I'm going to go ahead and leave the screen the way it is so that you can see it. And so, so for the type of diagnosis, admission, date of diagnosis, the time. And so what we want to do is, let me scroll down just a little bit. You could see here, it's gray. There's nowhere to enter it yet. And so what we want to do is we want to say new row, and that's going to prompt us to activate the diagnosis process. See, just press new row, and it already did it for us. Let me scroll back up. When I press new row, it did activate primary active number 1. And in diagnosis search, I believe, what did we put in the beginning? I believe we put, it was alcohol. And we did say 30 days, right? So the diagnosis per the doctor, treatment team plan, it's a severe alcohol use disorder. I discourage you from typing in codes because it could get a little, I would say, challenging when it comes to the way Avatar is set up in diagnosis. And what I mean by that, just like that zip code, it's connected to other systems. So is the diagnosis search. So we are not only going to see SUD diagnosis, we are going to see other medical diagnosis options as well. So if you just, I've learned if we just literally type in severe alcohol use, just like that, and you have to press enter, or you could use the button here, or you could just press enter. And this is what I meant by the other diagnoses that are available. Severe alcohol-induced major neuro. We want to stay away from that. We want to stay in our scope of practice. And what we know is this one here that's highlighted in green, right here. Severe alcohol use disorder. Just double click on it. Double click on it. And it populates our codes from the DSM-5. That's it. That's literally it. And we want to do the diagnosing practitioner, which was Amanda Wells. And double click on Amanda Wells. Okay. And then we did say, so we wanted, it was a, I believe the methamphetamine was a secondary diagnosis. So we just press new row, right? And we want to say severe
Paul, as you're going through, there was a question in the chat asking what's an episode. So I gave them a brief answer that an episode in Avatar would be similar to an admission in Simon. So, but I also gave them the caveat that I never use Simon. So,
okay, and that's correct. That's a perfect definition. Episodes, we used to call them openings. But you'll see I'll use another example. You're gonna, on that pre-display screen, you're gonna see all the episodes from SUD, mental health, ARMC. You're gonna see all those episodes on that pre-display screen. So I think that's what we were referring to. Okay. So I did enter that methamphetamine, but you could see I already chose it, and there's my diagnosing practitioner. Now I'm going to do is press submit. I'm going to say no, I don't want to go to the pre-display screen because I'm done with the diagnosis. And that takes us to our SOGI form. So San Bernardino County is working on a policy and procedure when it comes to this diagnosis. This data collection is called the SOGI, Sexual Orientation and Gender Identity. We're working on a form. What we do know is that when clients come into our treatment centers, this could actually be one of their primary stressors. So we want to make sure that we approach this with a policy, a procedure, and a form. Right now, we are not ready to collect this data, but it is in the Avatar system. Okay. So what we're going to do is just press the red X on the SOD form. It is part of the bundle. It is saying yes, close without submitting. Yes. That's it. That is literally an SUD admission bundle. Let's go over that one more time because we completed with the first client, the example client, but just wanted to bring your attention to down here to the bottom right of the screen. Do you see how Lisa, it says missing diagnosis? When we completed the SUD admission bundle, we got that primary dose diagnosis now. Okay, that's when we know that we're ready to move forward with the episode. Right here, bottom right. So let's do an SUD admission bundle for our other example, which is Lisa. Have the client highlighted, right? Have the client highlighted, and you type in SUD admission bundle, or you could just call it from right here. It's right here in your recent forms. Click in it. And that takes us to the diagnosis page. I believe that's when I said episodes. You will see, so this is, see this? This is the first episode, the only episode, because we haven't done the finance. But for some of our clients, what we know, there could be up to 10 episodes. But this is the only one. It's because it's a training example. Okay. So either you double click or press OK. That takes us to the diagnosis page. It's the admission diagnosis, the current time, blank. It is blank, and that's why we're going to do a new row that activates us to do our diagnosis search. And I believe for this example, we had said 30 days of methamphetamine use. More likely, it's a severe methamphetamine use diagnosis. I don't have to type in the whole word, just enough to get it in there. And you can see that it populates for us. Methamphetamine use disorder severe. Codes are in there. These are already in. Diagnosis practitioner is Amanda Wells. See all these are all the counselors here. Amanda Wells. It's there. Everything looks good. Press submit. No, we don't want to go to the pre-display screen. And again, as noted, right at this time, we're not ready to collect the SOG data. Policy and procedures on its way. So just press close form. Are you sure you want to close the form without submitting? Yes. Just kind of click on another client or form, and you can see bottom right, it has our diagnosis down here. Okay? Straightforward, right? Straightforward. And let's go back to here. Quick review. Did an ICL, short for initial contact log bundle. We completed the SUD registration, did that CalOMS admission and the CalOMS. We assigned the diagnosis. Now we're going to do the SUD financial eligibility process. Okay, so this is that second episode that I was talking about. It's something new to us. In Simon, we would do financial eligibility. We would look for Medi-Cal, confirm Medi-Cal. You're going to need to get the SIN number, which is that CIN number, from the, if you don't have it already, or if you can't find it in Simon, we're going to need to get it from the state website. And so what we're going to do is we're going to go through the SUD financial eligibility process. My suggestion is that you just kind of look at what I'm doing, and then we could practice later. And I'll remind myself, got to start with the admission outpatient, right? It's really easy for us, okay, me, to just go straight to financial eligibility since that's our topic here. But no, we want to start with the outpatient form because we got to create another episode. Remember, we created that RBATS episode, or you would be creating your episode, in your withdrawal management residential programs, ACJ programs. But now we're going to add one, okay? And that's this one. So what we do is we have our client highlighted. This time we're not going to use a bundle. Okay, we're not going to do an SUD registration bundle. We're going to call the admission outpatient form on a, I would say like on a single level, like on a single form. We don't, again, you don't have to go into a bundle. We're going to just say admission. And there's that admission outpatient form right there. Yes, that is included in those bundles, but for the SUD financial eligibility, we want to call it separately. This is how you do it. You can just put admission ADMI and it comes up already, all right? The client is highlighted, admission outpatient. And we are going to create an SUD financial episode. Okay, you notice that here we already have number 1 episode is the RBATs. And so we don't want to work on that one. We've already completed that. What we want to do is we want to go to the bottom left and complete add. And we could just say that that would be for today. See how all these demographics already came through? We could say current time. So the difference is when we go in here to program, we're not going to put RBATs or your withdrawal management reporting unit. What we need to do is find the SUD financial program. Okay. And so I can't zoom my screen too much because then I won't be able to see it myself. So we're going to drop down, we're going to program. And for this SUD financial episode, literally it'll be on the bottom, like they've never moved it. So it's always right here in the bottom. So you can see down here, there's a MH financial, which is mental health, and there's a SUD financial. Click on SUD financial. Client is active in other episodes. That's yes. If they have multiple episodes, they will. It just error. It's actually not an error. It's just an indicator. Just press OK. Again, this is the difference between everything we've been doing thus far is that we should see SUD financial as the program. Okay, we're creating that second episode. Type of admission, still an SUD. You can still use the same practitioner, which is Amanda Wells. If you notice on the left bar, it's still here. This is still the same. This is the form is still the same, but you can see everything has pre-populated already. Because everything was pre-populated, technically all I did was complete the admission date, the time, and the program, and type of admission and the practitioner. Everything else was pre-populated from the other admission outpatient. You could see episode number 2. This is a good indicator that we're on the right track. Submit. Advanced. Oh wow. All right. Good. Good. It's letting me know that I didn't scroll down to the bottom of the screen and complete these. The answer was yes throughout that intake. And we had put no for the advanced directive. Now we're ready to press submit. Okay. So just kind of like you could refresh by clicking out, clicking in to Eric. Now here's the difference. As you can see, now we have 2 episodes, the RBATs and the SUD financial. On all your new clients, existing clients, you want to see this. You want to see your RU and your SUD financial. Disclaimer number 1 is that on the SUD financial, we don't put a diagnosis. Leave it like that. On the other episode, you're obviously going to want your diagnosis, right? The other indicator is if there was an existing client and let's say they were had history for 10 years ago, 5 years ago, and we brought them over, they have assignment number and we brought them over, you're going to see that the client has an SUD financial episode already. In this case, we added one, but when they're existing clients, what DBH did, what they did was they brought over old Simon clients into Avatar. They brought in that Simon number, and they also added an SUD financial episode and a mental health episode for them. Okay, so if you see it in there, so what we're going to need to do is go in there and update it. That's all, if it's already there. But again, for today's training, we added that. Okay, so let's go through that one more time. Again, we're here. We're adding an episode. Use the SUD financial for program, right? And then we're going to go through that financial eligibility process, which is here. So let's complete this process again. What we want to do is we want to have Lisa highlighted. And we want to call the form, which is the admission outpatient form. Okay. Again, episode number 1, we want to go to the bottom left and click add. All this was populated. You can see the demographics is already populated, right? So if you're following along, we could just, I believe that we had put, was it the 10th? You could just backdate that. You don't want to backdate it, but it's just for the example. Just for the example. I believe I put admission. Let me check. So we could check, here's the admit date right here. It was the 10th, correct? So you see how I did that? You could try, without closing it, you could go back and forth. The tab is up here. So I'll just put the 10th, current time, right? And then that SUD program is always down here. Yes, that's okay. They are active. SUD admission, and then the practitioner. Amanda Wells. Okay. Submit. Oh. Those of you who are following along were probably laughing at me because I didn't do this again for the second time. It's because here's my excuse. My screen is not, it's zoomed in so I can't see the bottom. Okay, don't laugh at me. So yes, yes, and yes, and then we're going to put no. All right. Now we're ready to submit. And that's it. So I just kind of, we want to make sure that just click out, click in the system, the anywhere in the system. That way it could refresh and you could see the missing diagnosis and the SUD. Another way to check is if you simply just double click on the client and it opens up their chart, if you will. Later on, we're going to be working more advanced on the avatar, and we're going to be using this chart view a lot. But we could see that we're successfully, what we did was successful, and we created those 2 episodes, right? Which was here. Admission outpatient. And now we're ready for the next step on the financial eligibility process, which is literally going to financial eligibility. Again, this is something new in Avatar. It does have a few steps. Our main goal here is to assign a guarantor. What I mean by assign guarantor is that we need to place Medi-Cal into this episode. That way we can proceed with our billing, right? And what we know about treatment is that we have the client entering, the system. We know that we need to have medical necessity, which is, we've already completed that in the diagnosis. And now we need a means of submitting our billing, which is through Medi-Cal. So we got to get Medi-Cal as a guarantor. All right. So let's go back to Avatar, close this view. All we need to do is close it. And then we'll start with our first example. Have the client highlighted. And when we want to call this form separately, let me verify real quick that I'm following my steps. I already did the program. Yeah. So now I'm ready to do financial eligibility. So have the client highlighted, and I'm going to type financial. I don't have to type the whole word. See that? Well, I think it's just FI. Actually, yep. So FI, there is a bundle, but we're not doing that in the SUD training. So have the client highlighted, financial eligibility. It's going to take us to our pre-display screen. And when we're working with financial eligibility, we want to make sure that we're working on this episode, number 2, SUD financial. We do not want to do financial eligibility on your program. It kind of makes sense to do financial eligibility on the SUD financial. Okay. As I've been learning and working with people wondering what happened with the guarantor, what happened was that we accidentally clicked this and we did the financial eligibility. So no, we want to work on the SUD financial episode. Hopefully you can write that down on your notes when you're completing this form, SUD financial eligibility. You're doing that in the SUD financial episode. Okay, so you can either double click. I think that's what was going wrong, is that, see how it's highlighted right there? Like, so for me to make sure that I'm in the correct episode, I use the OK button down here. Okay, so I'm going to borrow a term from our NetSmart trainers back in April, and that with this form, yes, you can see that we have those bars. We have the financial eligibility and the guarantor selection. But with this form, you work backwards to move forward. And what I mean by that is that you want, our end goal is to have a guarantor here. Right now it's blank and it's gray. Our end goal is to have SUD Medi-Cal submitted here, okay? Again, right now it's blank. That's because we have to go to our left bars here and click guarantor selection. Just like the diagnosis, you can see it's blank here. And so what we want to do is, oh, by the way, there is a job aid on the website. It goes over this process in detail. I'm talking about screenshots that are, so I want to give a credit to our mental health SUD super users that worked really hard on that job aid. It is, I call this process complex. That's because I'm not used to it. So there is a job aid that if you if just don't worry about, you just take some notes and you can see there's a process to this. Okay. And so you can see that it is blank. We are in financial eligibility. So what we're going to do is we're going to click add new, just like that diagnosis. All right. So now it's ready to go. It's asking us for the guarantor. Okay. So what we want to do is we just want to type in Medi-Cal, and you could see that there's Medi-Cal mental health or Medi-Cal SUD. Just type in Medi-Cal or just click on SUD Medi-Cal. No need to get specific about Molina IHP. We'll just leave it right there. Okay. Let me do that one more time. Medi-Cal SUD. Okay. These remain the same. The guarantor plan leave. This is populated for a reason. Effective date, it's populated. It's at 2017. Leave it. And these are all these things that I'm about to do, process that I'm about to complete, are in the job aid. But we always want to click no on the customized guarantor plan. This is where on both of these, it's not red, but on both of these, we want to put that SIN number, that CIN number that either we got from Simon, Medi-Cal card, or the state website. Somewhere we could get that SIN number, okay? So again, this is in Simon, I think through the med system, it was pre-populating. Here we just need to enter it when we're doing financial eligibility. And there's a specific way to enter this, and I got to remind myself. So it starts with a 9, it has 7 digits, and it ends with a letter. Usually, throughout my time working, I've seen a lot of A's, ending with A's. So starts with 9, and then 7 digits, 7, and then it ends with A. If you do, here, I'll just leave the A out, and I believe it won't let me go forward. Actually, it did. So just make sure that you're doing that correctly, okay? Control C, and I'll just copy and paste that. And so again, that's that SIN number that comes from the Medi-Cal system. So for right now, we want to say on the eligibility verified, since this is the first time we're going through it, we want to say no. And the reason is later on, we're going to submit this guarantor, and then we're going to run a real-time 270 request, which is over here. But we're going to do that separately, okay? So for right now, we're going to click on no. This is where I start to say that that's why it's a complex situation for me, because I got to remember that we're doing all this so that we could get to the 270, and then we got to go back and click yes that we verified it through the 270. All right. So just a recap: new, added the guarantor here. Customized, no, we put the SIN number. But right now we're going to say no, we didn't verify the eligibility. Technically, we did not, right? And then this is on a coverage effective date. We're going to press. It's the day of the intake. You could just say today, and you just put the day of the intake. See how all this populated? And this is a good example of when we do the admission outpatient form, all this populates for us. So on the instructions, you're going to just, on the job aid, you'll see that you just click yes on all these sections here. Just click yes. It's part of submitting the form. Down here, there are some red fields, but they have populated for us. Just leave it the way it is. It has to do with the dollars and the cover days. That's already populated. None of this is in red. The majority of the other fields here, our DBH financial office is completing this. Our goal for our financial office is to add this guarantor here. Remember when I said we have to work backwards? So now that we have all this highlighted, all that we completed the highlighted fields in red, we go back to our bars and go to financial eligibility. We are in the guarantor selection. Now let's go back to financial eligibility here. You could see that we're this data has populated, but we want to go down. And remember when I said that when we first started, it looked like this. This one, it did look like it was gray. It was gray. But now you could see, because we added a guarantor, since we added a guarantor and we completed all the red fields, added that SIN number, now we could see that if we scroll down, that it's like this. Okay. The only way that it goes from gray to like this is if you complete the guarantor selection. Okay. So we want to make sure that we drop it down, and you could see it has the guarantor, the California Department of Alcohol and Drug, SUD Medi-Cal. We want to click on it. And what it does is it locks in that guarantor. It is gray, but this is your end goal here. Make sure when we're doing financial eligibility, that your end goal is that you want to see it look just like this. You want to see it in red, green, the way it was. You want to see it like this. Okay. That only if you see it like this, that means that we're ready to submit it. Remember my rule: don't press the red X because it won't submit. We want to do submit here. Okay. So we have completed. We opened up the SUD financial episode. We assigned a guarantor, and now we're going to run a 270 request. This is equivalent to checking Medi-Cal. I forget the number. It was like 2219 in Simon, and you would look at Medi-Cal and you could get that code. But in Avatar, we're going to run a 270 request. Okay. Open up the episode, do the financial eligibility, and the 270 request. Let me go back to Avatar. And so I'm going to unselect the client, because when it comes to a 270 request, it doesn't matter if you have the client highlighted, they still ask for the client's information. So literally type in 270. It's called a real-time 270 request. And then you just double click it. Okay. And that's why I didn't have that client highlighted, because it asks you for the client ID. It wouldn't matter if I had the clients highlighted here. And again, I called the real-time 270 request because we are completing this process here. 1, 2, and we are completing this third process. Sounds like a lot, but once you get used to it, it kind of happens quickly. So we're gonna say it's the training, Eric. Okay, right? See how everything's already. Let me do that one more time. See how there you go. See how there's no information here? But when I type in the client's name, now it starts to do this, kind of like that guarantor, right? So we want to click the episode, which is the SUD financial. And this is how you know that we were doing that, that we did the guarantor portion correctly, because it's red and it's asking us to pre-populate that guarantor that we selected earlier, which is Medi-Cal SUD. Okay. We want to switch this. It automatically goes to specific, but we want to switch it to generic. This is in the job aid, the instructions. It is laid out for you in detail. And so and then we want to say today, literally, and this is the way I learned it and remembered it, since it is real time, that's what it's called. Just put today's date. That's like a standard way of me remembering things. I have to associate things. So it's like, oh, from what day to? No, I don't want the whole month. It's real time. So I'm just going to say from, which is today. We don't submit. You could see that it's not allowing us to submit. That's because we're going to process the request here. See that? Process it. And so this is the part of the training where I just have to do the disclaimer that since I am in the test environment, the 270 does not come up. And I'll just stop right there. I can't explain why. It's the test environment. And in live environment, once you press process request, you're going to get a separate PDF document, and it'll give you that 270 report, report. That report is going to show you, you'll see it down here. There'll be an icon down here, and you'll see, and it'll look like a PDF, but it looks similar to this icon. And it's gonna show you if their Medi-Cal was active or not active. And it gives a little bit more detail in that. So just remember that you're going to get a separate report. Okay. And that's it. And then we just press the X. Now that we technically verified, right? We posted. After posting the real-time 270, we've done that. We're going to return to the eligibility, financial eligibility, and choose yes. Remember we clicked no, verified eligibility? We clicked no. That's because we haven't done it. We didn't do the 270 yet. So now that we've completed the 270, we're going to go back to financial eligibility, and we're going to click yes on eligibility verified. The way we do that, now we can have that client highlighted. Go back to financial eligibility, the form here. We want to make sure that we're choosing the SUD financial episode, which is this one right here. Again, I kind of do not double click, because when I double click, if I do this on accident, it causes some errors. So I just use the OK button. I'm back on the financial eligibility form. There's my guarantor that's there already. I'm going to go to the left bar, guarantor selection. Everything's populated. We've already done all this, except here, we pressed no. What we want to do is press yes. We did verify it. We ran a 270 request, and we could see that the client was activated and Medi-Cal had LA County. I mean, so it gives you in detail. Trust me, you'll see it when you run them. The 270 gives you detail. So again, we had said no earlier. We submitted it to get that guarantor information. Now we're going to go back and click eligibility verified. Yes, submit that, please. Okay. Again, a good way of verifying that we have the SUD financial episode. They're there. Let me get back to my instructions. And again, we clicked yes, and then we submitted that. Again, I consider it a complex process because it's something I'm not used to. I'm used to Calhouns. I'm used to groups, individuals, but this is something new. So hopefully my instructions are clear. It's just literally you do a separate admission outpatient form, open up an SUD financial episode, go into financial eligibility, add the guarantor, and we want to say choose no. There's my disclaimer. Choose no, submit that, run a 270, click choose T, today's date, generic, and then you post it, meaning you run that report, and then you go back to financial eligibility, and then yes on the eligibility verified. See that? Like, hopefully, like I spelled it out for you. And again, I'm gonna get this to you. I should start. I should start now and making it official. All I really have to do is put the county logo on it, and this is gonna be for you to. And I have to. I have it posted on my cubicle because I have to follow this every time that I'm on a trouble ticket call, and I'm gonna be there for you every step of the way when it comes to this data entry. Okay, so I promise I'm going to get this to you. When you put when you put in a trouble ticket, the first thing I do is email this to you and we go through it. Okay, so I got to get on it. Now I have an incentive to just put the county logo up here and make it an internal form. Okay, so again, I'm doing this. So if I'm sounding repetitive, I'm doing it on purpose so that we could review and I could remind myself where we're at. We did the ICL. We did an SUD registration bundle. We did that admission outpatient. We did the diagnosis, and we completed the financial eligibility process as well. Okay? So we have 2 episodes. So we're going to do the SUD financial eligibility process with our other client as well. So let's go back to Avatar. Go ahead and click on Lisa's example. And again, we're not going into a bundle just because we want to call the admission outpatient form. This is where we start to kind of move away from the bundle and start calling Avatar forms individually. And the way we do that, either we could type it in here, or you could see these forms are already there for me. So again, I'm going to say my common mistake, not yours or somebody else's. My common mistake is that I want to do financial eligibility and I go straight to it, to that form. And so just remember, you got to open up an episode first, an SUD financial episode first. So I'm going to have the client highlighted and then admission outpatient form, right? Because we're adding an episode. Okay, so our RBATS episode will populate as number 1. Oh, wow. Did we do that already? Yes, we did. All right. Let me make sure I'm on the same page with myself. Okay. I'm going to have, I just want to make sure I'm in the right track here. It does look like we did the financial episode on both of them already. But we want to do financial eligibility with Lisa. Okay. So we are here on the financial eligibility portion. So since there's an episode already, we're going to go to financial eligibility. Okay, we're going to click on the SUD financial episode. for financial eligibility, I use the OK button. And so our guarantor is going to be blank. Remember that? Just kind of remember that picture there, that it's blank. We got to work backwards to go forward. So we're going to do guarantor selection, right? We want to add Medi-Cal right here. Guarantor selection, just like the diagnosis page, it's blank until we add new item. Okay? So then we go to guarantor and we type in Medi-Cal. And click into SUD Medi-Cal. These populate for us. That 2017, we want to say no. Guarantor plan. Again, these instructions are in our job aid and they'll be available to you. You could print them, you could download them to your computer. The instructions are to put no. We don't want to customize a plan. And the SIN number starts with a 9, has 7 digits, and ends with a letter, which is A. And that's what that light bulb will tell you. You want to get that. The SIN number goes on both the billing policy number and the subscriber client index number, which is SIN, right? Okay. For the purpose of training, we're going to do no on eligibility verified. All right. Make sure we got that guarantor in there. There's the SIN number. The rest is highlighted in red. We got the Lisa training. And I believe this is the episode where we had put the 10th. So you just put the 10th there. For our instructions, you just click yes on these. Leave the coverage days and the maximum dollars, leave that there. Again, our end goal was to get that guarantor in here. Go back to financial eligibility. Remember our bars here to the left. Now we could see that we're ready to go. Again, every time I do this, every time I complete a training or I'm doing an example on the phone, I always want to make sure that this is what I want to see here, is that it's red. Remember, it looked like this, kind of looked like this, and now it's like this, and it's ready to add that guarantor, which is, and then it refreshes the page itself, and then it goes in like that. Awesome. It's in there already, and then we press submit. Okay. We have the client highlighted. We go back. We are here. We chose no, right? We added the guarantor. We chose no. Have the client highlighted. We're going to do a 270 request. Actually, you probably caught on. I just said that it doesn't matter. It says the client ID anyways. You don't have to have the client highlighted, right? And you just press training. Call up the client, which is Lisa. Episode number is SUD Financial. Good indicator that we completed the process because guarantor is red. So SUD Medi-Cal for the guarantor. Do we leave it specific? No, we want to change it to generic. And then from date, we want to press, since it's real time, we'll do it today. And then we're going to process the request. Notice that you can't press submit. That's because you want to process the request. And again, you will get a separate form, a separate PDF, and your icon will be down here in the bottom of the screen. And it's going to say whether the client was active in Medi-Cal. Okay. And then you just close it out. Again, one of my mistakes that I've made is, okay, I'm done, right? No, you got to go back. remember, like I said, this is where this is key. We want to go back here and press yes on that eligibility verified. So now we're going to have the client highlighted, financial eligibility, have the SUD financial episode highlighted. It's already in green up here. And I use the OK button. Just make sure that your guarantor did go through. Good news, it's there. And then on eligibility verified, earlier we had put no, right? Why? Because we haven't completed a 270. So we put no. So now we're just going to click yes and click submit. Right? We completed that right there. Go back to the financial eligibility. When if it's, I think my legend here says if it's italicized, it's a form in Avatar. So go back there, click yes, and just click submit. Again, I guess this is the third time I'm going to say it. Seems like it's a kind of like a complex process, but I've known people that's been working in Simon for years, and now they could they don't even need these instructions anymore. Yeah, they're pinned up to their desk, but they don't need them anymore because it's kind of automatic. It became automatic, and I think that's just because of practice and repetitive, keystrokes with Avatar. Okay, so I'm gonna pause right now, and as I pause, just kind of quick review: ICL, SUD registration bundle, SUD admission bundle, get that diagnosis in there, and then complete this process for SUD financial eligibility. We are technically, like, after this process, the client comes in for all their appointments, individuals, groups, treatment plans, and is generating, the clients are doing services. We are generating CDIs. And our next step is to do the CDI entry process. However, we're not gonna complete that yet. We're gonna enter services after lunch. So from now until lunchtime, which is 12, we're gonna go back. Let me just make sure I'm on track here. Yep. We're gonna go back. They've had episodes. And so what we're going to do is we're going to go into our CalOMS discharge process now, okay? They've completed treatment, and what we're going to do is we're going to go over the administrative discharge and the standard discharge. I'm not going to complete a youth detox discharge. That's because, one, I only created 2 clients, and 2, it's literally the same thing as a standard discharge. So what I don't want to spend too much time on going through the youth detox discharge, because again, it's literally the same thing as standard discharge, minus a couple of questions. And so I'd rather spend more time on billing than going through the discharge process. Just remember, when we are doing a CalOMS discharge, we have forms. We do have forms for the administrative standard and youth discharge. The counselor has filled them out for us, and they turned them into our front office. Or maybe one day the counselor is doing a live CalOMS discharge in Avatar. That's what I would like to see, is we're actually doing data entry live in Avatar. But for right now, let's start with the administrative discharge, okay? So we'll go back to Avatar, and we're going to close we used to call it a closing administrative discharge, right? So we're going to close episode number 4108, and that's our training. So we're going to call the form, have the client highlighted, and it's going to be CalOMS. All I did was type in CalOMS add AD, and it called the bundle for me right there. And that's the CalOMS administrative discharge. Okay, double click on it. And so what we want to, so here we're not, remember, we're not closing the SUD financial episode. Do you see how it automatically defaulted up there? What we want to do is we want to close this episode. Okay. And so what you do is you could double click. Just for me, just to play it safe, I use the OK button because I've made that mistake before. So, okay. We share this portion of the discharge with mental health in all our field-based programs. And this is there's the AVATAR discharge form and there's the CalOMS discharge form. Okay, there's two different things, but this is a bundle. This is the CalOMS administrative bundle, but we do share this form with mental health and our other field-based programs, crisis, contract agencies. So it looks a little different than our CalOMS. So what we do is we could say today's date for date of discharge, the time. What we want to do is we want to do current, type of discharge. Do you see where I mean where we're sharing the form with mental health? There's a lot of mental health discharge codes here. Just make sure that we're using the SUD ones and for the administrative discharge. It guides you. There's our unfortunate 2, the SUD, untimely death, and then incarceration. Those 2 are admin codes. And then the admin codes, left before completion with satisfactory progress, or left before completion with unsatisfactory progress. We'll choose that one. Okay. If you know the living arrangement, you could type those in as well. And again, this is a form that the department shares for discharge purposes. Wells, right? There's our Amanda Wells. And we're just going to submit. You could check over here for the demographics if you like, but everything has already been populated. Check this left bars. Click submit. Now this CalOMS discharge looks a little bit more familiar to us, right? To us. And so it's asking for a discharge code. And you could see now the mental health codes are not there. So I think we did satisfactory progress, left complete before completion. If you have this data, we could go ahead and fill it out. The primary drug code, I believe we did alcohol. If you don't know this information, it's the last known intake note, last known treatment note. If you don't know this information, you could just if it's common to do an administrative discharge and you don't know the frequency. So you could just press a number there, 0. And then down here, see how all this populated? I remember being a counselor, and an administrative discharge was one of the easiest discharges that's available in the CalOMS system. And that's because it only has a few data sets. All this already had populated. Okay? And that's it. You just press submit. Click out. and then call it back so that you can make sure that there's a discharge date down here. That,
Actually,
or you could double click
the bring them all here, all the books. Yeah. The purple and the two log books.
and you could see that there's a discharge date on the RBATS episode right there. Again, our notes from earlier, we never close an SUD financial episode. We only update it. Okay? Let's close out this chart. We completed our administrative discharge. So for our next example, we're going to use the CalOMS standard discharge process. A little bit more involved as far as data collection, and that's because we have the client in front of us or on the phone, and they've agreed to do a standard discharge interview with us. The same thing with our youth discharge. The youth is ready to leave treatment. We're on the phone with them, or they came to sign their discharge plan, say goodbye to their counselors, saying goodbye to their fellow peers, the newcomer, and they're an example. They completed treatment even though they didn't want to, and so now we have, and then for us it's a good thing. They're saying, "Sure, I'll do that last interview with you." So that's when we complete the standard discharge or that youth discharge. All right. So let's call the form up. It's we'll just make sure we have Lisa highlighted, and we literally want to say CalOMS standard this time. CalOMS. There it is right there. Oh, I had to complete the word CalOMS. And then I just typed in ST. Do that one more time. So CalOMS standard. And there it is right there. Double click on it. Our client's highlighted up here. So since this is a bundle, again, we want to make sure that we're following the steps. Again, just a precaution. If your financial episode is highlighted, we want to make sure that we're closing the correct one, which is this one. And then we press OK, or you could double click. It's up to you. And then we could say, again, this is the discharge avatar form. This is shared, right? And we could just, with mental health, we could just say current. Will give us mental health options. What we want to do is go all the way to the bottom, and our SUD codes are down here. So for the standard discharge codes, we could do the SUD completed treatment referred, SUD completed treatment not referred, and then we also have left before completion with unsatisfactory progress standard, or left before completion with satisfactory progress standard. So just to clarify what those mean, you could actually go into the CalOMS dictionary, CalOMS guide, and sometimes clients have stayed in treatment 65, 70 days, haven't quite reached the 90-day goal the counselor had made with them, but they got a sponsor, they've been clean for 72 days, got the child back, moved back in with, is no longer homeless, but didn't really complete that 90 days, right? But they still have satisfactory progress. I mean, again, the sponsor, the child. I mean, everything, you know, sometimes it takes a little longer for other clients and they have to stay the 90 days. And that's where we would use completed treatment, you know, referred or not referred. So that's just a quick example of the difference of the codes. If you want to read more on it, you can go to the CalOMS data guide, and it gives you detailed information on what those codes mean. Okay, so since we're doing a standard discharge, we'll just go with the example that they got after they completed treatment. They're being referred, right? SUD completed treatment, referred to another level of care. Let's just say for now they need to go to some prevention classes to get another certificate that they needed for court purposes. Sometimes we don't refer them and they simply just say not referred, right? So we'll stick with referred. Click in our practitioner, Amanda Wells. Make sure nothing else is red down here. Our demographics are already taken care of. Okay. And we click submit.
So what you're gonna do is you're gonna go to choice because we don't have no
Now,
unedited box.
this after remember there's the AVATAR discharge form, and then there's the CalOMS discharge form. This is the CalOMS discharge form. And so literally it's the same questions as our admission CalOMS. Remember we were asking about primary, secondary drug use. We were asking about employment. We were asking about criminal justice status, medical, mental health, and family social data. Literally the same forms. Those of us have been around for a little bit know that usually when you're doing this interview, the answers are going to be different. And I'll show you a quick example of what I mean by that. Because they came to our treatment center with using methamphetamine and alcohol for 30 days straight. And now I'll use my example. And now they have 72 days clean, right? 72 or maybe 90 days. They completed the whole treatment and they have 90 days clean and they've gotten things back, if you will. And so these answers are going to be a little different. And so a year from now, the state of California runs data on admission and discharge for San Bernardino County, and they could see improvements and trends in how a client enters our system of care and exit our system of care. Okay, that's why CalOMS is so important. That's why we spent a lot of time adding these light bulbs. NetSmart has done a great job in giving us a prompt that if we are doing an error, that we could complete it without submitting it. That way, again, our data going up to the state is going to be enhanced, if you will. And we're going to get a better look at how our county and all the hard work we've done, whether the client completed treatment or not. Okay. All right. So there's my spiel on CalOMS discharge. I get excited about this stuff. And so we've completed the AVATAR discharge form. Now we're in the standard CalOMS discharge. And so, yes, you could contact me at a later date for a follow-up. No disability. You can see they're not red. They're supposed to be red. We can go down here to the discharge status. Make sure we're completing everything in red. And what did we say? We said that client completed treatment recovery plan and is being referred to a different level of care, right? And so there's our first bar. And just like our admission, CalOMS admission over here, you just go to your next bar, which is CalOMS discharge primary drug. I believe this episode we had said methamphetamines only. And so you could see, again, not to sound repetitive, but I am being repetitive. These are the same questions, the same light bulbs, but we're doing this 72 days, 90 days later. So we're asking them in the past 30 days, they're looking at us like, I haven't used that all. All these answers are zero, right? And I don't, there was no, I think it was smoking. They didn't have a secondary drug code. That was a good question earlier, so we put none, right? And that pre-populates all this. And no alcohol in the past 30 days, no IV use in the past 30 days. Again, this is like the end of treatment, and they've done so well that these questions are significantly different. And let's say they got a part-time job during treatment. So now, remember, they were like, I haven't worked at all, and now they got a part-time job. So now we're going to put 15 days. They did enroll in school, yes, and they're getting job training as well, right? The highest level of school that pre-populated already. So what I'm trying to do is give you an example of how different standard discharge is. We had put zero. Hopefully, they didn't get arrested or they were in jail during this treatment episode. And then, there was no emergency room visits, no hospital visits. And I think earlier we had said that the person complained of a back problem, but one of the treatment goals was to get a physical completed and work with their PCP, their primary care physician. And so what they found out was there was actually something that needed to be corrected with a chiropractor. That's just an example. So again, we had put one with medical problems earlier, so we're going to press zero. And so do you see the difference? And that's actually data that could be compared later on, like a year from now, where clients are walking in with medical problems, sometimes several medical problems, and by the time that they leave treatment and they're doing this CalOMS standard discharge interview, they're saying those things have gone away or I've already taken care of them. So again, I want to show you how we could use this data later on down the line. Right? So zero. I think Lisa said that she wasn't sure that she was pregnant, and then we found out through our doctor appointment that she was not. And she finally got tested for HIV. But again, our question, and where we're training our counselors, when we're training our interns, is that we don't want to ask this question and say, what were the results? We don't want to ask it like that. What we want to say is that here it is, did you receive the results of your HIV AIDS test? Okay, so it's just a training point. So did you receive them? And you just say yes. Okay? And then we go to mental illness. And so again, we're asking through the light bulbs or our forms. There's no identified mental illness. 0 days on emergency room visits due to mental health, right? Those are two separate questions. Emergency room because of medical, and then they're asking emergency room because of mental health. Two different items there. Did they go to a psychiatric facility past 30 days? 0, and no mental health medication, right? Okay. I did say that the discharge form is a little different than our CalOMS admission. In my world where I get everything that I request for, I would love to have the CalOMS admission form look like this when it comes to the question. I think in the CalOMS admission, it only says, I think it says social support. It only has literally these two, but the question is on this discharge form. So it's a better idea, better way of asking, in the past 30 days. And of course, we know that clients, sometimes if they're in residential, they're going to a 12-step meeting every day, or they have some sort of recovery activity every day. Interaction with family has increased. Friend support has increased. And so what we'll say here in the past 30 days, and then the client answers us, have you received any of these recovery support, services? Or they're like, yeah, I've been to a meeting every day in the past 30 days. So that's how that difference is. When they walked in, it was only like 5 or 0. And now when they're leaving, you could say that they're increasing their social support with every day 30 days. Living arrangements, I believe we started with homeless, and now they're living back with their significant other. And then it says days living with someone who uses alcohol and drugs in the past 30 days. That was 0. When they first came into treatment, we had put 30 days. We had put, I've been out in the streets and everywhere I live, everywhere I go. Yeah, so it's been around me all this time. Now I could say that not only am I clean, the people around me are clean as well because of I changed my environment, changed my people, places, and things. Okay. Conflict with family, we could say that's 0 now, right? And then we use the newborn as an example. So we still want to say how many children age 17 or yes is 1. And then, obviously, under 5 years old, we want to say 1, but they are no longer living with their grandparents. Remember, my example is that the child was removed after birth, while they were in the hospital because of the client's situation, homeless, drugs, CPS was like, maybe like, they were about to get involved. Something happened, right? Something happened. And so they had to go live with somebody else. And the other extreme example is that the parental rights were terminated and they're living with somebody else as well. But since this is a standard discharge, and this is a more positive outcome, what we all want to see eventually is that the child is no longer living with somebody else. The client has custody, or is now they're living in the apartment with them, or something more positive, or they moved into a child-friendly sober living. And so we could say in the example we had put 1 that they're living with somebody else, but this is the way it's going to look at discharge. Right? 1 newborn, now they're 4 or 5 months old, still under 5, and we put 0 here because they're not living with somebody else. Okay. I just wanted to show you, hopefully it works. One more time, what happens when you submit. Hopefully it stops me. I don't think I've tried this with a discharge, but if we forget to fill out something and we submit, it does give us that error. And it's common when we're in a hurry and we're doing data entry. It's common for us to make we don't mean to, we just skip a step, we tab over it. And again, one of the positive things about Avatar and this NextMark product is that it gives us a stop, and it says that you forgot to do this. And so I want to say what we never want to do when we get this error towards the end, what we never want to do is click on continue filing. Let me say that one more time. We never want to say continued filing. that means that if we click on that, that we've ignored this message, we did not correct the error, and we're going to submit it anyways, right? That's not like us. We don't purposely make errors. We're just, that's not us. What we want to do is return to the form and correct it, okay? So hopefully I've never seen a trouble ticket or report where this happened. If it happens by mistake, it does. It is what it is. But again, this is something that's this is actually like a EQRO intervention that we're going to submit to the state as well. Is that, you know, we're doing everything we can to enhance our data collection and to minimize errors in our CalOMS data collection process. All right, so we just do return the form. The filing was automatically canceled. Great. And what we want to do is we want to correct that error. And we, since this was the increase in social support, we put 30 days, right? Then we submit it. Oh, okay. This is actually something I didn't do. And maybe it was in the chat that I missed it and I can't see the chat. Enter the social security number. Okay. Return to form, right? Always do the right thing. Return to the right button over here, right form. The filing was canceled. And I believe it was, it's here. I don't have a social security. This is actually the example where I did not put a social security number, and we don't want to, in the admission outpatient form, we did use the nines, but this is what it calls for is that 99902, formerly known as Z2. Now we can press submit. And just to make sure, click out of the client, kind of click in there. Make sure you see a discharge date. You can actually open the chart by double clicking. My internet has been kind to me today, and so I appreciate the internet today. And we could see that, again, the open episode is the SUD financial episode, which remains the same. It also remains that there's a missing diagnosis. That's totally fine. What we do know is that we did financial eligibility on the SUD financial episode. We added a guarantor. All that is good. We're ready for the billing. And here we know that that there's the discharge date. So there was the opening date on the 10th, and then the discharge date of the 19th. The only way we could get that is that we're completing these discharge processes here. Again, I won't go over a youth discharge. Just remember that if Eric or Lisa was under the age of 18, we wouldn't go to a standard discharge. We would go to a youth discharge and complete the same, I promise you, the same exact process minus a couple of questions. Okay, so I'm looking at the time. Just a quick, I'm gonna stick with my examples here. Just a quick review. Is that we started today with the initial contact bundle. You'll hear the word ICL. Did you do your ICLs? Where's your ICLs at? Your initial contact bundle. We checked to see if they had Simon numbers, and they didn't. So we actually proceeded with the contact bundle, and we added the call intake, call initial contact log, entered that data, submitted it. It went to what we call as a P number, a pending number, totally fine. And then we assigned that medical record number. I think throughout as we advance, we could just say, you know, we assign the client number. That's the avatar language. Okay. Then once we assigned the medical record numbers, client IDs, we went to the SUD registration bundle and we completed an admission outpatient form, CalOMS admission, emergency contact information that actually transferred, right? All this work here, all this work in the SUD registration bundle, admission outpatient form, all that work transferred to the discharge process. It transferred to the financial eligibility forms. And again, so that's why it's really important that you do a good admission outpatient form. Okay, completed that. We added the diagnosis, and we skipped on the SOGI form. And again, San Bernardino County Department of Behavioral Health working on a form, policy, and procedure on this so that we could start to collect that type of data for our clients. I could say that it was going to be optional. The clients do not have to fill this. I'm sorry, does not have to go through that interview. We're not going to be handing them that form for SOGI. It's going to be an interview. We want it to be with a clinician or an interview with a counselor. Again, some of our clients, that's their primary stressor is gender identity, sexual orientation. So we want to do an interview with them. And that will be with a certified counselor, LPHA. And then what I call the complex process is the SUD financial eligibility. Now that the SUD episode and diagnosis was entered, we open an SUD financial episode. We do that because we don't want to do financial eligibility on your program, that not your mental health systems program or your VARP and corporate. We want to run financial eligibility in our SUD financial episode that we opened. Okay, and our main goal is to add a guarantor, which is Medi-Cal. And then just don't forget that after you do that, because we click no, that we have to do a 270. Just remember that term. Just remember it, 270, Medi-Cal. Running Medi-Cal, let me do a 270 real quick. Some programs do a 270 every day. Every time that the client comes in, they'll do a 270. And then once we do the 270, return, I should highlight that or bold it, return to financial eligibility, and we click yes, we verified eligibility through the 270, click submit, and we're done. We're completed that process. And again, we went over this information as well. We did a CalOMS administrative discharge and then a standard discharge. Just remember that those forms, I'll just show you right here, is that there's an avatar discharge form. Do you see that? I can't zoom into this type of screen, but you can see that there's a standalone avatar discharge form. Okay, just what we want to do is we want to stick to, when we're discharging clients, we want to stick to our bundles, our administrative discharge bundle, our standard discharge bundle, or our youth discharge bundle. Okay, yes, they're standalone forms, but when we're doing our instructions, we want to just make sure we follow this guide right here. Okay, so I'm looking at
real
our
quick before we break for lunch. Did you see the last question in the chat? The discharge date, the last date of service at the facility. Is the discharge date the last date of service at the facility? Was the question.
Okay. So welcome back, everyone. Hopefully lunch went well. And so what we want to do is I just want to do a quick overview of what we went over this morning. And then we'll get into the client charge input, the recurring client charge input, And then editing service information. We've come to know this as CDI entry, CDI billing. And so it's just slightly different language in the Avatar system when it comes to billing. But to review before we get into billing, just remember when you want to open a client's chart, you could double click on the name. It's highlighted and the chart opens. And as we work more with Avatar, you'll be able to see more data in there. But before we get into billing, you always want to make sure that your SUD financial episode is in there. So in this case, you know, the training examples for today, just double click on there. And you'll see that hopefully both of them are in there. You can see the SUD financial is there as well. How you could update, like I said in the beginning, a lot of clients, majority of clients that were in Simon transferred over to Avatar. So they came with an SUD financial episode and a mental health financial episode. So if that's the case, if a client is already in Avatar, already in the system, is coming into treatment, what you want to do is you want to update the financial, the SUD financial. And how you could do that is, you know, bring them up. You want to bring them up into recent clients. I think I was using Paul's, let's say Paul's coming into treatment, and I want to bring them up over here on the recent clients. And again, we wouldn't do an initial contact log, or I'm sorry, initial contact bundle, because he already has an Avatar number, right? But I do need to, you could see that he has an SUD financial episode right there. So I need to update that. Let's say it was didn't have Medi-Cal, or it was unactivated for a few years. And so you just, if the, and we confirmed SUD financials already there, right? And so you could just go straight to financial eligibility. Since there's an episode already, straight to financial eligibility. And you just want to update it accordingly. Just open up the SUD financial episode. And anything that needs to be updated, you can go ahead and do so. What we do know, this is a good indication that we were doing something right. And that's the fact that the guarantor is already in there. And I could see that we added a number 2 guarantor, so that's awesome. That's a default signal that we need to put in there too. If they don't have Medi-Cal, we're not sure of the guarantor, we can put that in there as well. So good example on let's do. Again, let's say this client Paul came in and we need to update these guarantors. This is exactly how you do it. You just have it highlighted, double click on that financial eligibility, and choose that episode, and it comes to this form again. All right. We always want to see in financial eligibility, we want to see, this is just something for your notes, screenshot it, picture it. When we're dealing with financial eligibility, this form here, this is what we want to see. We want to see that the program is SUD financial. And other trainings, or when I've been practicing where I wasn't understanding how come the financial piece wasn't working, it's because I had like the RBATS episode here instead of the SUD financial. So, it's just something to take note of. And then, of course, you want to get in there, and if you want to add a guarantor, just add the new item and go through the same process as we did. Okay. So that's how you would update uh, a client that, let's say, a few years have passed, and the client comes into treatment. That his client number, the Simon number, has transferred from Simon over here to Avatar. So again, you could just go straight. And I'm sorry, you got to make sure that the SUD financial episode is there, right? And you just go to financial eligibility and update that SUD financial. Put a different insurance in there, or update their insurance for nothing at all. Okay, so you'll see as you work through your clients and you get your login, you're going to see that happening a lot. So just make sure you put in your notes there to do an update on SUD financial. The forms that we used all day are here, and you can see they're actually in order of how we have my reference sheet. We did the initial contact log bundle, and those are for those new clients, Eric training and Lisa training. We assigned a permanent medical record number. That's because, remember, when we do those initial contact log bundles, you'll see that there's a P in front of that number, and that means it's pending, that they're not technically in the system yet. And when they're ready to go, when we're doing all the intake paperwork, you just go ahead and use that form, assign permanent medical record number, and press yes for assign, auto assign, and it will give you the new client ID, the new medical record number. Just to make a point of emphasis, make sure they don't have assignment number, because we can enter the assignment number in here as well. If they did, more than likely they can't. The assignment number transferred into Avatar. If it did not, just go ahead and submit a trouble ticket, and we can work on that. Okay, and then the two SUD bundles, the SUD registration bundle, we did that for opening the client. What we call now it's an admission, right? We did the admission and the CalOMS intake, the emergency contact information, and then we assigned the diagnosis by using the SUD admission bundle. So very important. And then to the bottom right of the screen, you'll see that the diagnosis is entered in there. All this is leading towards getting ready for billing. And then we completed the admission for we opened the SUD financial episode, and we could do that. So there is a bundle in Avatar that says financial eligibility bundle, but we did that we called back the form the admission outpatient, and we opened an SUD financial episode. You don't use your RU, you drop all the way down, and it'll go to, let's see if we could open this and I can show you. Should open. And this is what I was talking about here. In this case, if you drop down the SUD financial episode will be all the way to the bottom of the RU list. But we've already worked on this form. And that's actually a good example, is that you could, if you want to check to see what you entered, you just highlight the client, click in the admission outpatient. We could actually choose the other episode as well, Just double click inside of it, and there's all the information that we entered. Notice the difference there. Program is RBATS, and that was our example. But of course, yours, you'll see IBHS, Inland Valley, Cedar House, your RUs will be there. Okay? And this is how you just kind of verify what you've done, or you just want to check. So, the next thing on the agenda, though, okay, and then I'm sorry, then we after financial eligibility, we did the 270 request. That's how you verify Medi-Cal. I'm in the test environment, so I have a limitation on that. But you'll see it's an open PDF form that when you run the 270, make sure you do financial eligibility first. When you run the 270, in the bottom of your screen, you'll see an icon, and that means that your report has been generated and opened. Okay. So again, all this is in my instructions, also on the website instructions as well. Then we practice a quick administrative bundle, discharge CalOMS, and then the standard discharge bundle as well. So that's a quick review of what we accomplished so far in Avatar. Again, just a reminder on your forms, you could call them individually like this, or they're in bundles. You can see there's that bundle right there, or the admission outpatient form is separate. The admission outpatient form here is in the SUD admission bundle. So I would just stick with the bundles, and we'll be okay until you get to financial eligibility. And again, they're in the instructions. Okay. One of the things that we wanted to show was to do, let's say I just wanted to update Paul's information. I'll leave today's example. But again, let's say I wanted to update Paul's, he came in a couple of years later and has a change in information. You could do that on the top, on the right of your screen here. You can see there's a link where it says update client data. This is why I encourage that if you don't need all these tabs open here, see if I put them back, see all these tabs. If you put them back, you're going to not have too much room. Sorry, all these tabs were open in the beginning, and so you won't have too much room to see up here what's going on. And so, as you could see, that I could actually type in update client data. It's called right here, update client data, or I could use that link there. So we just have the client update highlighted, update client data. Let's say has a new phone number now. Pretty simple, straightforward. I just wanted to show you an example of how to update any data. It's straightforward. It's called the update client data, and it happens quite often where they change cell phones or they'll move, and that's how you do it. And just simply click submit. Or when you have the client highlighted and they're over here in your client demographics, you can just click and it'll take you to the same screen. Right. Add a work phone. Just submit it. Now, go ahead and write this down. In our live environment, there's a form and it's called Women's Health History. Okay, do me a favor and write that down. Women's Health History. And that's the form where you can add their pregnancy date. Let's say a female client comes in and notifies us that she's now pregnant. And so that's very important for several reasons. One of them being health concerns. I would say number one. But the other is if you have a program or an RU that is involved with perinatal. And so what we want to do is we want to add that pregnancy indicator. And so in the live environment, it's called Women's Health History. And I believe it's not in the test. Yeah, it's not in the test environment. But the old version is, it's called client condition pregnancy. Okay, so I don't want to confuse anyone, but in the test environment, it was called client condition pregnancy. And in the live environment, which you'll be using, it's called Women's Health History. Okay, but what we could do, I could just have the Lisa highlighted, double click on client condition pregnancy. And simply what we want to do is we want to add the record. So just add, the client ID is training Lisa. One of those situations where I had it highlighted, it didn't matter, right? I still had to add the client ID, right? All right, and then episode number. We want to do the RBATs, not the SUD financial. And then simply put in the pregnant start date. We can just press for today. And then on the end date, it's not the estimated 9 months from this. It is not the 9 months from this estimated. It's when the client actually has the child. Then you go back in there and you type in the date there. Okay. And so that's it. Just remember that this is the date of the pregnancy, and then the actual end date, not when they had the child. Again, in live environment, it's called Women's Health History. And all you do is you press submit. And it says, do you want to complete the return to the form? You could just say no, and it'll take you back to the home screen. Okay. So we went over the update client data, and then again in Women's Health History in the live environment. Okay. Straightforward information, straightforward examples. And again, you do that, we could have these clients highlighted and you go to those forms, except for that client condition. It actually doesn't matter because it asks you for the client ID anyways. See that I have Lisa highlighted like throughout my examples through today's training, but there's some forms where it doesn't matter. You still have to add the client ID. Okay, so just some Avatar 101 things that I've learned throughout the trainings. Another thing to note, let's say I want to deselect this. So if I hover, you could hover over it, and you could actually, I'll give you a better example later. But you could hover over it, and when you want to deselect something, you could press F5, and it'll deselect for you. In other words, it'll clear the field. So F5 clears a field. Say if you had it, like it's not allowing me to do it right now, but if I want to like just get it out of there, F5 will do the job. Okay. Another Avatar 101. Okay. So that's my review, and again, I wanted to show you those couple of simple forms. Again, you can make the screen the way that you could, you don't have to have it. I'll show you this example here. You don't have to have, like, Avatar is going to give you this view. It's a standard view, but you could, and you're going to be using this one more. So, you could, you could, you can make, you could customize it. You customize it. And so, and again, all your tabs were down here. Those are still here if you need them. Okay. Don't forget about the wiki page, which is you go to the help up here, and then you could do the NetSmart homepage, or you want to go to the Avatar CalPM. And if I click on that, it'll switch screens, take me to the internet, and it'll take me to what we know as training guides. And but just make sure you're in CalPM, Avatar CalPM, and it'll give you examples of how to use forms that we've been talking about all day. And in addition, so this is just a supplement for you, because we have our job aids that we'll get on the website. If there's not something there that I mentioned today, I'll make sure to follow up and get the forms on there. Okay. So again, just don't forget about the wiki page. It's a good resource. Let's see if I could see that that I am sharing the screen, and this is what the wiki page looks like. So you could see that there's information on the guides. You could drop down the client management, the services, the billing, right? A lot of different information on what we were going over today. Okay. So there's the episodes. There's, see where I was talking about the assigned permanent medical record number, and it gives you information on how to complete the steps. Okay. So again, you want to make sure you're in the CalPM, and then use this as needed. Okay. So this is an addition to our job aids. Just wanted to show you that. So we should be back on our avatar example. So let's
Paul,
get into.
like you had a couple of comments in the chat where
Okay.
some of the Simon verbiage, a couple of people are saying that they're not clear on the difference between what was Simon verbiage and possibly Avatar.
Okay.
But they didn't. Well, one did say someone was closing an administrative discharge. The other one, I didn't give any examples. So I'm not sure where they got lost.
It's okay. Well, this is just a simple way to say that what we used to call a registration in Simon, that registration form, it was a two-sided form. It literally said registration on it. That is replaced with the admission outpatient form, which I'll just go ahead and open it. This admission outpatient form is now the replaces Simon registration. So now it's called admission. And so, in for the opening, we used to call the CalOMS opening. We used to say, well, that's the opening. Where's the opening page, right? And it had all those. It had all the information on the CalOMS. Right? There's that, and then we also, did I discharge them already? Let me make sure that I show an example.
Paul, and I got some clarity. The original question was, what is the difference between a discharge and an administrative discharge?
Okay, I'll go over that.
All right, thank you.
So real quick, I went to SUD registration. This replaces Simon registration, this admission outpatient form. And then we used to call, in Simon, we used to call, it was a CalOMS opening. You know, there's a 2-pager again, but now it's called the CalOMS admission. Okay. So I'll close out of that. I believe this is the question here. So the difference between all these discharges is that on a CalOMS administrative discharge, we're not completing the CalOMS interview. In other words, the client has left treatment, is incarcerated, and we have to do a CalOMS administrative discharge because they're not available for us to answer the questions. So you'll see in a CalOMS administrative discharge, there's very few fields that we have to complete. There's probably like, I don't know, I'm going to guess like only 5 fields you have to complete. But on CalOMS standard discharge, what we're doing is that the client is ready to leave treatment or has completed the recommended amount of days in treatment. And at the end of this episode, the client has agreed to complete a CalOMS standard discharge interview with us, either over the phone or they've come into the office and we're just doing the last, wrapping up treatment, doing the last paperwork with them, making sure that we have a phone number for future consent, discharge planning, and then we do the CalOMS standard discharge. So again, administrative, we're not doing the interview. In CalOMS standard, we are doing the interview. The same concept applies to CalOMS youth. The exception would be is that the youth is 18 and younger. Okay, so when we're using the youth discharge, we'll be interviewing the client as well. So hopefully that answers the question. And we can move into our billing examples, which to me takes a little bit more time to explain. But you'll see there is some steps that are very different in Avatar compared to Simon. All right, so are we ready to go into billing? We are here in the client charge input.
I would say so.
Yeah. Okay. All right, so here we go. So so we are going to start the billing process. We've already discharged the clients, and usually what happens is we open the episode. We open the episode, or sorry, I need to start using the language myself. We completed an admission, right? And so now we're, in between all this, the treatment, what we do is we enter billing, then we discharge, right? For today's training, we opened and closed already, but the training environment will allow me to enter services, although I did discharge the clients already, okay? So the same concept, and again, we do have a job aid available for this as well. It goes step by step on how to complete this process. So what I'm going to do is, I believe I could have my client highlighted. So now we're going to enter some billing, okay? So what we're going to do is go to search forms, and it's called the client charge input. And then there's the recurring client charge input. The difference is that we could enter multiple service in the recurring, and on this client charge input that I'm about to show, you just enter individual services. So it's the client charge input, which is here. All I did was enter client. You could be more specific if you want, and it starts to narrow down the search. So double click on it, client charge input, and we're going to enter some SUD services. Okay. I got some, I wrote down some codes from our CDIs. We are going to have our new CDIs coming out soon. Where we had to adjust pretty much our whole system of care had to adjust to these different codes and the location codes. So again, be patient with us. We want to get, once we launch, excuse me, once we launch our final forms, we want to make sure they're solid, right? And so here we are. I'm going to enter some treatment plan and some intakes. And so I didn't write down the intake code. So you're gonna have to excuse me for 1 second, unless somebody wants. What's the code for an assessment? ODF assessment. I
180.
184. $184. I know they're in here. I just want to make sure that I'm using the correct codes. Doesn't let me make sure I get a client in there, and then we'll try it from there. So I'm going to put today's date. You could obviously put other dates, but I'm going to stick with today's date. And then client ID, we're going to put the training. Put the client here, and it'll say the episode number. We want to make sure that it's the RBATs, and then the program is that. And then the service code. There it is right there. Thank you guys. It's the ODF assessment, right? So we have the date, the client ID. Once you enter the client ID, these drop downs populate for you. You just got to choose which episode. And then the program itself. And then we want to use our practitioner. It was Amanda Wells. How long does the assessment take nowadays? 70 minutes? Around there? And then So you type in the 70 minutes, that's red, the practitioner. We're still looking for the red codes, for the red fields, excuse me. And there is nothing down here that is in red. Okay. And here's the disclaimers. We'll use a crisis example later, but if it was a crisis code, we want to add the emergency indicator, and I'll show you how to do that after we submit a few billing examples. And then again, for this pregnancy indicator, we want to make sure that we want to do our women's health history so that we could get the pregnancy date on there. Okay, so that's it. We have all these red fields, and we just simply submit the form. And then in this case, I don't want to be closing the form in and out because I have a lot of billing to complete. So it does say, do you wish to return to form? Throughout the whole training, I've been pressing no. So, but in this case, I'm just going to press yes so it could leave me here because I got a few CDIs to enter, right? Majority of us could relate to this. We don't want to be going back and forth. Okay, now I got to do it again. No, you just, when you say you enter a service and just make sure that you press yes, you want to return to the form. Okay. So let's do a couple of more examples for this. So again, once I enter the client, these options are already populated for me. You just got to choose them. See that? Just got to choose them. And then, so 174 is the individual counseling. And again, I know there's several codes. I'm just using, quick examples. So they did a individual service. Just want to make sure that we get the practitioner in there. It was a 25-minute example. And again, these are not emergency services. So all we do is hit submit. Yes, we want to return to the form, right? Later on, there was actually a crisis for this training example. We want to click the program. I know this isn't. I'm gonna put intensive outpatient, but there's an ODF crisis code as well. Okay, but I just wanted to just to show you because we are gonna have to put the emergency indicator in there. But I know there's an ODF crisis code. But IoT usually is SUD services. Is it 236? Sometimes I could see the chat, and other times I can't. So thank you. So there it is, ODF crisis services. And then so we'll get the practitioner in there. And this time, the crisis was like 83 minutes. Okay. It doesn't automatically say, the avatar is not going to warn you with a warning and say with a bulb or a light bulb. Just know that when we're using crisis codes, that we got to go back and do an emergency service indicator. Okay. Hopefully everyone's following along. We're just entering some services, and I'm always clicking yes because I don't want to be going back and forth to our forms. Okay. So, but actually I'm gonna close it out. Because I want to go back and edit that. I want to add that emergency service indicator. Okay. So what we want to do is it's called edit service information. So literally what I typed in edit and there it is. That client is highlighted. And so I just want to double click. Okay. Well, there's another form where we don't need the client highlighted, right? So training, we're going to bring up Eric as the example. And then the episode number, there's the RBATs that we've been using throughout the whole training, right? Those two things are red. And so what we want to do is we're editing a service. We're going to add the emergency indicator for that crisis code. Hopefully, if my billing went through, all I have to do is go over here to the right of the screen and click in select services to edit right here. And I wish I could make the screen, but you're going to see the services that I entered already, right? And so there's the assessment, the counseling, and then right here, you'll see that that's the crisis code. I need to put an emergency service indicator on there. So I'm just going to select that and press OK. And so it brought me to now I'm like live that I can make my modifications. And so what I'll do is go down here and I'm gonna press yes. This is for that emergency indicator. So on the original form, this option is not on there. I have to use edit service information to do this. Okay, and what we know is when we use a crisis code, it has to have the indicator. So simply I just put yes and submit. I'm gonna go ahead and press no. I just wanted to show you another quick example. So I'm gonna go back to client charge input. And kind of show that it does have this verbiage here, but that option is not on this form. The emergencies, the indicator is not here on the form. See that? It's not here. We have to go back to edit service information and put that in. So let me just add one more code for this one. Again, I'm in the client charge input, client ID. Okay, choose my episode. Program populates. And did we add a treatment plan already? We'll just add another. Of course, we're gonna have different dates, and throughout the week, throughout the month. I was just giving basic examples of how to enter CDI billing codes in here. Okay, there's our 1 through 6 dimension review. What I did skip over is location. And so it does say DBH site for our contract providers. That is your office location. There is no option to put contract provider office or another indicator. So when you're doing your work, you are at the DBH site since you're contracted with DBH. Okay. And again, we are working on these codes so that we could get you a clean, up-to-date CDI. Okay, so if you need to choose these, go ahead and do so. There is no phone. So I believe the consensus was when we're using phone as a location code, it is non-face-to-face. So that's the consensus right now, is that we're on the phone. We're using this code right here, non-face-to-face. Okay, and again, we'll be getting our CDIs, updated CDIs very soon. So, but again, if you're doing it at the office, more common, just use the DB8 site. Okay, just press submit. It's saying that we have I think I put 2 individual counseling. Probably should put a treatment plan in there or something. So we'll just press yes. So I'm going to press yes, but now I'm going to use our other example, which is, so we want to get some billing for this one as well. And I will be doing the group codes with Lisa, okay? So again, either you could use your recent forms here, or you want to do client charge input. Client charge input. I believe my second example, I'm able to use some previous dates. So I'm going to do 8/10 and then the client ID, training. This time it's Lisa. There's our episode number here. The program pre-populates, and then the ODF treatment plan, the practitioner. "45 minutes." Okay, same thing, and we submit it. Yes, because I don't want to go back and forth. I want to enter a few more services. So for the difference in Simon and Avatar, if I remember correctly, in Simon you were able to go into group. You're going to do a group billing, and you could enter all the clients in that group on one single page. So in Avatar, it's actually different. You have to enter the group separately. It won't allow you to enter other clients into your group billing. You could have a group name for DBH, but in other words, that's the difference, is that it's, even though it's a group service, you have to enter it individually. And that, I would say, the significant difference between Simon and Avatar. Something we're just going to have to get used to, and we'll go from there. So now I'm going to enter a group service. So we did training, and it was Lisa. Okay. Enter the episode. And then, so I believe it's a 262 for ODF. Okay. So before I do this, what's going to happen is it's going to give me a code. So you're going to have the CDI, you're going to have the group, how much people there are in there. And so when you click it, it's going to ask you the number of clients in the group. And that's how the system distinguishes, what day and what number of clients are in the group. Okay, so I just put there were 5 members in the group. You're gonna know this through your CDI, right? You just press OK, and then your practitioner, and then our traditional 90 minutes for the group. And I believe it does its calculations. You'll see here, it does its calculations because I put 5 members. And that's it. Like I said, it is so like in Simon, you will be able to put all your clients here. 5 members will go here, but all we do is submit, and that's how you enter a group service. Okay, I'll do that one more time. That way I won't have a duplicate code. I'll change the date. And then we'll just do client ID, training. Can I get a residential bed day code? And I'll show you. Because I know that I believe there's a residential provider on the training today. Hopefully it won't lock me out because I have an RBATS example, but is there a residential code that I could use, a bed day?
No responses so far.
No responses so far? Okay. I'm going to do do I see, what was it, 496?
Yes.
Okay. And there are no minutes. You press submit. I'm going to go over, I know there's probably some questions, so I'm just going to go over the recurring billing, and then I'll stop and we'll ask questions and do some more examples. Okay. So let's say I'm not sure on what situation this will happen because it's literally the same code and the same time frame when we use this recurring charge input. Okay, I would say maybe an individual for 15 minutes every day all week, but that's kind of an unrealistic example because what we know is it doesn't always take 15 minutes. Or so what we're going to do is we're going to call the form. It's called recurring charge input. Okay, and recurring client charge input. So again, we're going to say I had the example where I had through, then we're going to say from date through today, right? We either include the weekends or we don't. Actually, you could probably use that residential code for the bed days. So we're going to say, no, we don't want to exclude the weekends. And so you could see that all these dates are here. Again, this is the difference between recurring client charge input and the regular client charge input. I'm going to select all these days, right? And then it'll be the same thing. Client ID is going to be training. I'm going to go ahead and try that code again. The bed days. I know that this is not a residential facility, but this is just a demonstration, and we don't put minutes, or they're just doing bed days. So you see, I'm about to submit this code for this client for all these days here. So on my other example, I was doing the codes, entering CDI codes individually. So once I click submit, I'm saying that this is a 496 code for Lisa for all these days, right? For all these days here. That's the difference between entering services individually or using this recurring client charge input. So I guess in theory, this would be a good example for our residential providers that are entering services for all week, right? Because you're not putting minutes on a bed day. You're literally using this. All right. So if I'm ready to submit, I just submit. Okay. It says that I didn't enter a practitioner. All right. I'm going to step back a little bit, and so what we've done is that we went over an example for client charge input, several examples for client charge input, and then what we just submitted was this recurring. And then when we went to edit service, we went ahead and added that emergency indicator. Okay, so that's what we completed in Avatar thus far. Usually this is part of the training where I do stop because of how, I would say, complex, unique our system of care is, and that what's the same for residential is not the same for outpatient. And then there's some sub questions that have to do with charting and maybe some other codes. So at this time, Eric, I'll go ahead and stop, but we did complete the live examples of client charge input, recurring client charge input, and edit service information. Yeah. Okay.
Yeah, you're good.
Okay, thank you. So what we're going to do next, again, we went over client charge input, recurring client charge input, and we did that emergency indicator, right? So now I want to do like a general overview of what we've completed thus far. And so a good way to do that is go into what is called the client ledger. And so when we think of a ledger, we think of a summary. And so what we're going to do is we're going to go in there and we're going to run a client ledger for our two training examples. And one, you're going to see the importance of financial eligibility. And two, you're going to see a verification of what services were put into the system. Okay, so there's other reports to verify data entry, but the client ledger is something that could be used to verify what we entered in Avatar. All right, so my Avatar screen is up, and this might be one of the forms where I could just have the client highlighted and we're going to type in client. Let's type in the word L, letter, excuse me, L, and there it is, client ledger. Okay. I think of it as a summary. It is one of those forms where we do have to enter the client just fine. I just make it a habit to, if I'm working with a particular client, I want to have them highlight. Okay? So here's actually a good example of an Avatar 101 on a side note. Do you see up here in the top left? I actually have the client charge input form open. So as you go, you could actually have several forms open, but I have both. I have something open up here, and if I did have that client selected, it would actually go towards this form. So just let you know, like I don't necessarily want the form open, so I'll just go ahead and close it. Let's just have one tab open. See that up here? And that's the client ledger. Only one tab's open. All right. So so we're gonna do a ledger, and we're just gonna do all episodes, right? And it already populated the date for me. And so down here, there's the crystal reports and the simple report. And I'll give you the both examples so that we can look at them on a separate. But we're just going to say crystal for now, and include. Oh, you know what? There are indirect services that can be inputted there, right? And we can do that as well. So we'll just leave it like this. Crystal include zero charges. The $0 payments, yes, we want to see those too, just in case they were indirect services. Okay, we could do all episodes. We want to do all episodes. And press. I believe if you click episode, you're gonna have to choose whatever you're working on there. Okay, so I'm just gonna do all, and we're gonna process this. And we should see our report coming up. And so again, this is that client account ledger that I was speaking of. And we could see that we have all the information that we were entering. Okay, so you could see, you could see the liability, the guarantor liability, and there's some dollar amounts. More like maybe a fiscal person would like to see something like this. We could run a client ledger, and you could see that these are the services that we entered for that particular. Let me see, 8/19, just that particular day. But if you choose all episodes, you'll be able to see, that whole. I'm sorry, all services, all episodes. You'll be able to see more services. So we only entered these. So there's our assessment, our counseling, the crisis, right? Remember our crisis that we edited? It's in there. And there's some total dollar amounts here. So the difference between this view and the other view, simple and crystal, is that these are actually links. So if you click on the link, it shows you a little bit more detail about what that is. An ODF service code, the mode, and then some other information as well. Okay. So again, if you just click on the link, we'll go from there. Okay. In live, you're going to see more data than this. It'll show the practitioner, site, service duration from there. Okay. Now, I'm going to use the same example, but but this time I'm going to put a simple report. And I'm going to run that. I'm going to process it. Just to verify, are you seeing my screen when it comes to the reports? Just a simple yes.
Yes.
Okay. This one I could zoom in. Actually, 200. That's the max amount. So I wanted to kind of summarize our whole day from our CalOMS admission to actually it was the ICL or CalOMS admission, and then we did a SUD episode, and then we did financial eligibility. All that activity I just mentioned is summarized in this simple client ledger report. And the reason why I say that is because we have to have a guarantor. We have to have a guarantor to actually run a ledger, right? And so you'll see that that's that default county, the 999. That's that county code. You could see that the units of service are here, and the guarantor, how much they're going to absorb that cost, and then the balance, and then for all the episodes are here. Okay, the client was discharged already, and you could see there's the total amount right there. So again, it's important to do financial eligibility because the guarantor, this is where we want to verify that guarantor, because this is how we're going to have successful billing going towards Medi-Cal. And that's why we want to pay attention to that financial eligibility and make sure we get that SUD financial episode in there. So let me run the report for our other client. There goes Lisa. We could select the days to today, right? And then we want to do the simple. And let's just say, let's try this. We did the specific episode, and then we're going to process it. Simple report. Process it. Again, this is that client ledger that we're talking about. And again, we could see the doses that we entered, and we could see the guarantor as well. Right here on this guarantor, what we really want to see is the Medi-Cal guarantor. And so I believe either I changed the guarantor throughout the example, or it's because I'm in the test environment and it's not showing me Medi-Cal. But you'll see the Medi-Cal, your SUD Medi-Cal guarantor here. So, and then you'll see the reference here. But you can see these are all the services that we entered. And this is a good way of checks and balances when it comes to looking at the CDI entry. Okay. And then you could save it as a PDF, or you could print it here, put it in their chart, scan it. Actually, you could scan it into your chart, and we could go from there. Okay. So, yeah, so that was that client ledger. And that is a way of verifying how we could enter those services and that they went through. And again, our end goal is to have that Medi-Cal guarantor in there. So at this time, it's going to be 2:30, and let's go ahead and pause right now.
All right, we're good.
Okay, so we left off at client ledger. So I wanted to give you another example of what a client ledger. So I've had this episode in here already, but I believe this one does show Medi-Cal. And so just again, click on client ledger, call your client, and then get your. This is where I was talking. Remember that alias that I was talking about? You could see that on this example, the actual name was Paul, but there's an alias of Pablo. So just that's how it will show up. So we want to do all episodes. Again, I'm just going over the client ledger one more time. We're going to do simple, yes, and then process it. The date's already populated for me. I'm just going to process it. So far, so good. And so you could see that I use that the recurring charge input. You can see that I did those 170s and some services here. But the difference between that other example is that my guarantor actually does say on this example, this is why I wanted to try it again to show you that. Remember when we went to financial eligibility and we did all that work, and then we made sure, that was my point of emphasis, that we make sure that Medi-Cal SUD guarantor is on there, and it's for this reason here. So you can see that this one did go through. This one is that Medi-Cal SUD, and then there's the code right here in the ledger report as well, that guarantor, and they're going to be paying for this amount of services. And so, again, just wanted to show you another example. The other example's good as well, except that guarantor went to the default. I believe it's that SUD 5001, which is fine county. But again, if they do have Medi-Cal and it was verified, and we did do that 270, at the end of the day, we want to make sure we see something like this so that we know that when we're submitting our billing and we're doing the next steps that happen after, the next steps that happen after, the CDI entries are complete. And so that's more of that the fiscal training and the fiscal part of the claims. See, this claim is open. Claims open. What happens after this is that the claims, they get submitted, and they create a batch of claims that goes up. Once they get cycled, then the claim is closed, and then you can see that right here. But for right now, this is kind of where we stop. Is that we did the admissions and the discharges, and then we from our CDIs we went over our client charge input, or the recurring client charge input, some emergency indicators, and then again circling back one more time to that financial eligibility process. This is why it's so important. Is down here to the bottom left, you'll see that they are Medi-Cal SUD. Now, I think you could zoom in on this report, but I think I have it maximized. So if you just go down here, just put it at, I have it at 200. and we would go from there. This is how you zoom in and out here. And then you could actually save it as a PDF. And for those of you who have existing EHR already, you could get that PDF and put it in the client file wherever you file your financial information. And or you could option of print it old school. You could print it as well. Okay. So to get out of it, just dismiss. And we're gonna close out this form. And so now we're gonna go into some of the avatar reports, and this brings us to this part of the agenda here, and we're actually showing. And it's my understanding I got to get the agenda up there to the website so we could do that. So we're going to start with a couple of forms, a couple of reports that I do know that works. And one of them is the MHS 140. So we know that as a face sheet. As a face sheet, we used to call it a face sheet. We used to call it the client summary. But now in Avatar, we could call it's called the MHS 140. Some of us know it as a 140 simply. So if you just click in and type in 140, it shows up as client face sheet. Okay. And so this is one of the forms that I didn't mean to, but I did have Paul training highlighted over here. And so I didn't mean to do that, but it was highlighted. And so it took me to the client face sheet form. And again, since it's already there, we're just going to process it. Okay. Same thing as this is actually a good example. When we run that 270, just click yes. When we run that 270, and I was saying that there's going to be an indicator in the bottom of your screen. There's going to be an indicator that the process has been completed. And so I was hoping it would show up down here at the bottom of our screen. So seems like it does take a little while to generate, which is fine. This is why the reports are towards the end of the training, simply because they do take a little while to load. And so in the bottom of my screen, I do see an icon that the report's ready to view. And so you just kind of click on that, and we're going to see I would say the new and improved face sheet. So my screen is cycling, so just give me a minute. It should come up soon. Okay. I could zoom in maybe a little bit more. So the reason why I say improved, number one, if you notice, is simply like the way it looks. It's a little, the fonts are the same, but when I say improved, one is that I called a 140 from my computer. Okay. So what we know in Simon is that, like, particularly where I used to work, I would have to walk out of the group room or the office or wherever I was at. I had to go all the way to the front office. I'm saying it like if it was a task, but I'm just giving an example. And then I had to ask somebody else if I could have a 140. And if Simon was being nice to us that day, we would get it, and then we'd have to make sure that we had paper in the print queue, right? So what I'm getting at is this new 140 can be generated from your logon in Avatar. And so again, one of those enhanced experiences that I'm trying to give you, that we could do things from the computer that we weren't able to before. Okay, so we have the client information, and when I put preferred name, that's that alias that we were talking about, right? And we could see now once financial gives us an FI code, we're going to be able to see the FI code and the expiration here. Okay, and then there's our our guarantor information. We're going to see that's Medi-Cal, and then there's the SIN number that we were talking about. We're talking about the SIN number, the emergency contact information, which comes from the SUD registration bundle. That is populated here. So we could see that there's my emergency contact. The name was parent, and there's the phone number right there. Relationship was the mother. Hopefully remember that from our SUD registration bundle example. And then on the history, we're going to be able to see a good example of the way that the 140 used to look like. And you could see our program, the diagnosis, opening and closing, and then the number of units. You could see that there was 1938 units. And then you could see that last service, which was on 8/12. Okay. So again, this is something that we could look forward to when you're doing Avatar. And again, you can see this and save this on your computer, or if you want to print it. But again, when we're doing intakes, and those of you who have EHR already, you could have this in a PDF format. Whereas before we would have to print it, scan it, save it, and then upload it somewhere else. So this is one of the reports that I know that generates in our testing environment. Okay. So again, once you're in the, I'll start over. Once you're in the home screen, you can have the client highlighted, and then literally type in 140. Oh, I didn't have it highlighted. Or you could call it from the recent forms here. And then simply just process that request. Okay. So that's how you call that 140 report. It'll probably take a minute to upload, which is fine. And while it uploads, let me go back to the agenda and introduce you to these forms. I'm sorry, these reports that you're going to be able to run when you are up and running with your programs out there. And so you're going to be able to run a Medi-Cal eligibility, that the service report for your reporting units and statistics, your caseloads. Then it goes down to your absence of service, the registration, and that monthly charge input. In Simon, I know they've had names. I think it was like the PSP. There's the SBC 100. Remember, those forms would come from our print queues. And so these are forms that you're going to be able to run when you get to your logon and you have data entered into Avatar. So for the purposes, I'll run a couple of them, but again, I am in the test environment. So we could just kind of just look at an example. We're not going to see any data, but I'll show you the example of what these reports look like and another way how to get to them. Okay. So our 140 for today's example already came up. And so this is what we were working on today, right? So Eric training, there's the information, the demographics, and you can see just like the other example that he has Medi-Cal, and then there's the policy, the effective date. Our emergency contact was Paul. Training, I was his friend, and then that history. That's our example for today. The number of units was 5. We only put 5 services in there. And we'll go from there. Okay, so I'm gonna run a report in Avatar to see if we could get some examples. It's just a warning that we do have limitations in the test environment. One way to get to, I can't zoom in this screen, but one way to get to reports is to hover over and click on the bottom of the screen here, depending on how your view is, but it will be right next to your recent forms and your search forms. You're going to see where it says Avatar PM. It's right here, Avatar PM. And what you do is you can click on it, and that calls some more drop downs. And you could go to billing, right? You go to billing, and then you just go to the right, and you could go where it says BHMIS reports. And so what I was showing you on the agenda is the list here for your reports. Okay, so one more time, let me just click out of it. Right next to your recent forms, your search forms, you're going to see a link that says Avatar PM. Click on that, go down to billing. Yeah, you want to make sure that you're hovering in between, because if you go out, it kind of clicks out. So you want to go to BHMIS reports, and here we are with our available reports in Avatar. Now you're going to see more specific numbers, and this is what I was talking about, the PSP or that MHS call for those reports, the call numbers for those reports. And the MHS 140 is in here as well. You see that? And so what I'll try to do is do a caseload. We'll try to do a caseload and see if that comes up right now, because I know for a fact that we do have data in here, but again, you just click on that. That's that PSP 121. So here's something for your notes for today, for a takeaway for today. When you're running these reports, these BHMIS reports in Avatar, and when you put in your reporting unit number, I know some of our programs have multiple program reporting unit numbers, but we want to use the one when we're doing reports. We want to use the one that ends with a Q, which is that Q right there. So there's the regular reporting unit 36011, but then it ends with the Q. Because if we use the regular 3601 and we 3601 and we call that one, you can see that this is traditionally the way that we do business. It looks, this is the way our RUs look, but you can see it says inactive, right? So it's not going to give us the report data that we want. Okay, so there's just a takeaway for today's training, that we want to, when we're doing the reports, choose the one that ends with a Q. We could think of the Q as a query, or running a query. And so target date for caseload, you just want to choose, I'm just going to leave for today as an example. And then you process the report. Again, it's a hit and miss on our live environment, but that's how we're running a program caseload. in the RBAT system. It'll take a minute to generate. And then we want to press no. And as the report is generating, we could go ahead and go back and get ready for the next one. And so again, we want to do Avatar PM, billing, and then go to BHMIS reports. Okay. So let's take a look at what the caseload report looks like when it comes up. More than likely, we're only going to see the format and not actual data. But I'll just show you the format. And my report and my screen is cycling. So just give me a few seconds. This is common, by the way. It's common for the reports to take a little while. I have standard internet connection, and even at work, our reports take a little while to get up. So, okay. So, hopefully that's not too. Let me see if I'm missing something to the right. Let's try 150. Okay. So, excuse me. This is the test environment, and I'm excuse me. I'm not the only one who has been using the 36011 episode. RU. So you could see that this staff. This is the active cases as of today. You could see all these test examples here. Test Sally. I remember one of our first trainings. These were some of the clients that were going in. So again, when you see your report, you're going to see that you're going to see your RU here, and you could do active cases as of today, or you could have said last week. But again, this is that PSP 121 report. Okay, and again, there's an option to save it. You just click on the floppy disk icon, press OK, and select all, and then it'll give you a way to save it. All right. So actually, we did get lucky. There was some data to show you. Let's try one more. So we did the client phase sheet 140, program caseload 121. Let's see if we could call a report that has services. So again, Avatar PM, billing, BHMIS reports, and let's see if we could find one that has client services. And we could, the more common one that you're going to be using for your fiscal and your submitting to DBH fiscal is that 142 report. Some of you already been using it in Simon, but there it is right there, that 142. But let's see if we could do a client specific service listing, which is an MHS 912. So that's saying that for this particular client, let's run a report on how much services were entered. So there's client specific and then there's program specific. So let's check this out. Click on the form. And since it's client specific, okay, another example, I already had Paul highlighted over here in the home view. So again, if you have it highlighted and it's that type of form, it's automatically going to go to your client there. So let's see if I could just client ID and run it and process it. And we're just going to press no. And then it's going to take a minute to process. So I know there might be some fiscal people on the training today. And so again, familiarize yourself with these BHMIS reports. And if it's not working for you, if there's a report that's not working for you, submit a ticket, a trouble ticket to the DBH helpline. And sometimes it's just a matter of giving you proper access. Sometimes it's just connecting your account, your RU to the report. Okay. And so you could imagine how much RUs are in our system of care. Hundreds. I don't want to say thousands, but there's hundreds of them. And so sometimes, let's say my role in Avatar, I'm more of a clinical person. So I'm going to have limitations to an MHS 912 report because that's something normally that my role in Avatar doesn't do. You know, so somebody more on a fiscal administrative side probably needs access to that report. And so your roles sometimes will be adjusted. Okay, so let's see if it did. So I did a MHS 912 report. And so you could see that it's almost like a client ledger if you think about it. It's another way, it's another example of how to run a report in Avatar. So there's all my service dates and the assessments and everything. This one actually says total time, and it breaks down the cost. Total of 13 hours, right? Total of 13 hours. And there was my, so sometimes program managers or supervisors, they'll ask, can I get, if we're working on a specialized case, they'll ask, what were the total services billed on that particular person? And so again, this is where we stress the importance of doing the SUD financial episode, doing the Medi-Cal guarantor, and the CDI client charge input information, because you could pull up a report like this. So I am actually getting lucky, and we could actually see data on our reports. So I'm going to try one more. See if we could pull up something from a program specific. And we already did what? We already did a 121. We did a MHS 912. Well, how about a staff caseload summary? That's program specific. And I assume if I run this report, we're going to see different staff members who we're going to see their caseloads. So again, this is just a test data. And so hopefully something will come up. So beginning date, we'll make sure we do specific dates. Let me backdate it a little bit. We'll say from June till today. And then the 3601. Again, we want to make sure that we're choosing the one with the Q. Okay. And then we're going to process this. I'm going to go ahead and press no and let the report generate for us. And as we're waiting, let's see if we could find something else here. Or we could just talk about as we're waiting. So again, I did mention that if you are having trouble uploading the reports or calling up the reports, make sure you put in a trouble ticket, and we'll get you a response, and we'll get you linked into what you need. So my screen is cycling through. Probably a good sign that there is data to look at. Again, just a reminder that you can save these reports by clicking on the floppy disk icon up here and saving them to your PDFs. And there'll be multiple reasons why you want to save them. So feel free to make a folder on your computer, or if you need to upload them to your other EHR, they'll be available in PDF. So it looks like I'm still cycling. Might be some data there. Then we'll go. As I wait, just want to it'll let me know that when the report's ready. So again, we are coming to a close on our agenda. I'll make sure that the agenda does get up to that website that has our forms from training. But again, you could actually see the list of these reports actually in more detail in Avatar by clicking the Avatar PM billing, and we go from there. So my report still hasn't came up on my screen though. So I'll try a different one as we wait. Is that the 206? This is the report that you could see where there's both direct and indirect services. Actually, this is direct services. So before I go into that, so this is that caseload summary again that that I was talking about. Just zoom in a little bit, and you could see that this is actually staff specific. So you can see all our staff are here. See all our counselors. There's our example. There was actually Amanda and Alice Wells. There's our example. And you could say that there was, for this time frame, from June 1st to August, for that time frame, the beginning cases, new cases, closed. All this is tracked through these SUD registration bundles, right? When we're completing an admission and we're completing a CalOMS, either administrative or standard discharge. Okay, and you could see, unduplicated clients here. Client hours. You see my examples have a little bit more hours direct services, and that's because we've been entering CDIs. See that 45 there. So again, this is a 206 MHS 206A, and it is for your more of an administrative supervisory report. to see the number of cases that your staff has. This is actually a check and balance, if you will, to make sure that our episodes are being not only open, but they're also closed as well. Okay. So one more time, just gonna call up billing, and then you do BHMIS reports, and you end up in this area here. So at this time, we did see a few examples. Actually, fortunate to see actual data in the client and staff reports. So this is how you access these BHMIS reports in Avatar. At this time, we'll go ahead and pause the training. And Ohms. Or you could just type in Cal. Just type in Cal and just, if I do Cal Ohms, it actually eliminates the annual update options. So if you type in annual, you just type in annual, it'll bring you to the Cal Ohms annual update form. So thanks for reminding me. And so what you want to do is just double click. And it's not going to let me because let me look for an open episode. But what we do is there has anybody been following along and has an open episode? So to answer the question, that's what you do is you have the client highlighted, and then you just go to Cal Ohms update, Cal Ohms annual update, and you can see it's not allowing me to because oh, okay, it's actually letting me do this. Hopefully, if I click in it, so if I double click in it, it says Cal Ohms annual update. And we're going to say add. Yes, we're in a test environment, so by this time we have uploaded our we submitted our Cal Ohms admissions. Okay, so it's the same thing as our Cal Ohms admission. We're just gonna do, there's the annual update. Okay, and so we'll just go through the bars and see if anything needs to be updated. The record to be submitted, right? And let's say we want to change this to 0. This is what we do in an annual update, right? We're just updating the Cal Ohms information. So not enrolled in school, now they're enrolled in school. And job training. Now this is 0. Right? They've been doing good in treatment. We could put 0. Or mental illness, same, we'll just put 0. Again, we're just doing an annual update. Good question. And then we'll increase the social support to 30 days. When you're done updating the information, simply remember since it's an update, we need to submit the new data. And that's it. There's your CalOMS annual update. Good question, and I do realize there's withdrawal management